today, we expect that you've identified things that you think could be relevant and applicable to your country or to your workstation. It's sad that all of them are, but I believe there's one or two or three things that you've heard that you could implement. So going away from this workshop, we'd like you to commit to a bit of action that you can follow up on, maybe like 2-3 months down the road. So those commitment forms will be shared with all of us. Then still during that session, I'll share with you a reporting template that we shall be using to follow up on the commitments you make. If you're committing, let's say, to have an engagement of stakeholders back home on this subject, in that evaluation form, we shall be looking at how many have you talked to? In what way did you talk to them? Did you have a meeting? Was it a one-on-one meeting? Was it a Zoom call? The only intention of this is to ensure that we weren't just having a small chat here, you're actually discussing matters that we are going to work on. So I'm going to take you through briefly a recap of what we discussed yesterday. Yesterday, discussions were mainly on legal framework and policy, capacity building, and risk communication. So for legal framework and policy, we started that day with a session facilitated by Mr. O'Neill Hamilton, who is the CARICOM regional coordinator from the UN Security Council Resolution 1540, and also the UN Counterterrorism Executive Directorate focal point. So he was taking us through a lot of policy in combating GCBRs, and also sharing with us how we can capitalize on public-private cooperation in addressing GCBRs. Thereafter, we had a session by Dr. Susan Kropp from the FBI, who was sharing with us how the FBI is going about limiting access to dangerous pathogens, vetting who has access to them, what kind of access do they have, which organizations or associations are in charge of handling that whole process. And I think yesterday, Lieutenant Colonel Dr. Baga shared that Uganda is having an almost similar program. I don't think they have given it a specific name yet, but I think they're having a way of vetting who deals with dangerous pathogens. So I don't know if other countries have also had the chance to implement such, or if they have plans on doing that. But the whole point of such a program is to limit access to pathogens that could be used for harm. So still on the session of legal framework and policy yesterday, we had a topic by Dr. David Musunga, an Assistant Commissioner of Biosafety and Biosecurity in Uganda's Ministry of Science, Technology and Innovation, and he was sharing about the challenges in developing and implementing GCBR policies. He has been part of the process of developing the biosafety regulatory framework for Uganda and also working on the biosecurity policy. So he was sharing with us the considerations, the challenges they've met and how they've tried to go about them, hoping that probably in our respective countries we can pick a leaf or two on how we can initiate the same processes and ensure that they're actually successful. Thereafter, we had the session on capacity building, whereby the very first topic was what kind of capacity is required to effectively combat GCBRs. Before we seek to build the capacity, what areas do we have to address? And that was facilitated by Dr. Irene Naigaga from the Africa One Health University Network. And they are sharing with us how they have tried to engage especially students in the universities through the One Health approach. And the suggestion came up to have them being more intentional in their policy work. Not just engaging stakeholders in here and there, but actually being purposeful about trying to get policymakers to care about biosafety and biosecurity. There's also a suggestion to have them incorporate in their courses a course on biosecurity and biosafety, so that as we look at this whole surveillance and disease response, you can also have those aspects incorporated. We had a session by Professor Diafka from Tufts University on approaches to developing capacity building strategies. Now, Professor has been part of a number of initiatives, especially by USAID, to build capacity in Africa and Asia and other continents. So he was sharing with us what was the thinking, the rationale behind implementing some of these projects. What have they been able to learn over the years? What have they been able to modify? And all that, which I believe will be crucial to our discussion later today as we try to come up with things we're going to commit to doing after here. And the last session of the day was a session on risk communication, whereby earlier in the day I had given each one of us a questionnaire to fill in, drawing back from our experiences with the pandemic, how you felt, why, what your families asked you about the outbreak, what they wanted to know and why they wanted to know that kind of information. We also looked at what the expectations were of, especially you being the decision makers in some of these aspects. What they were expecting public health officials to do and why they were expecting them to do that. So thereafter, after discussing those various questions and responses, it took us through some of the things we have to consider while doing risk communication. And he noted there's the way scientists and public health officials tend to think about risk. We assume what people may want to know, yet actually the public, their interpretation and reception of information is kind of different. So why we had that questionnaire is, first of all, to try to understand what the public actually wants to know, so that in communicating, we are addressing those challenges. And the other thing he encouraged is that oftentimes regulators, scientists, and public health officials, they tend to leave a communication gap that creates chance for misinformation and disinformation. So there was an urge to us to be proactive when you're doing risk communication. Let's not leave a lot of questions hanging unanswered, that those who have their own agenda can take advantage of that space and misguide the public. So that ended the discussion of yesterday. Later in the evening, we had a chance to catch up, those of us who are staying here. I'm actually quite impressed that all of us were able to come here early. I was expecting some of us to be extra tired. But anyway, let's carry on. So basically, that's what we had yesterday. So today, I mentioned the sessions we're going to have. And our very first facilitator is already in the building. So I'm going to give us a chance to reflect on the discussion of yesterday. So I'm going to pick randomly whoever is here, and I ask them to share with us what their takeaway message was from yesterday's discussion. So the first person I'm picking on is Esther, and thereafter I think I'll pick on Dr. Ernest. So Esther, what was your takeaway message from yesterday's discussion?
Okay, thank you. Good morning, everybody. So starting with the session of role of policy in combating GCBRs, take note message was the importance of cooperating with private as well as government. Let's say government has to cooperate with private sectors to ensure that they are aware of importance of safeguarding the community against risks that are coming from the products that are making and the society is using, but as well from the session by Dr. Susan Kropp, I had a chance to learn on how the US Federal Select Agent Program is working, and that will help me back in my country to at least have a say when they start inventory of these select agents, but as well on challenges in developing and implementing GCBRI policies by Dr. Musunga. I had a chance to understand a journey to implementing these policies and challenges that I might face on the way. And at least I got to grab a knowledge on how maybe I can tackle the challenges during preparation of these policies, or what challenges are on the way to making these policies. On capacity building by Dr. Irene, I had a chance to understand the importance of building capacities from low levels, that is pre-service level, so that to create a future of people who can at least talk about these risks that are facing our community. Thank you.
Thank you very much, Esther, for sharing with us. Dr. Ernest, you can share with us what your takeaway message was from yesterday's discussion.
In English, it is very difficult for me to explain my idea.
No, don't worry. We have.
I listen. I write.
We have a volunteer translator here, so I'd like to request Dr. Christian to assist us. So you can speak in French, right?
Oui.
All right. So then.
Oui. Voilà. Donc hier là, nous avons vu effectivement plusieurs exposés qui parlent effectivement des problèmes, des événements entre la biosécurité et surtout les agents pathogènes, la collection des agents pathogènes dans les différents pays. Et nous avons vu... No, I speak... No, he's going to summarize it.
Tu peux aller par étapes. Yeah.
Et puis après, tu vas résumer.
Non, non.
Non, il va traduire.
Ah, d'accord, d'accord. OK. Hier, là, nous avons vu plusieurs exposés.
So yesterday we had many presentations.
Et parmi ces exposés, nous avons vu effectivement l'exposé qui concerne la biosécurité et la biosécurité.
Among them, those on biosafety and biosecurity.
Les agents, la collection effectivement des agents pathogènes, l'exemple des États-Unis.
And the knowledge on the pathogenic agents and the case from United States.
Ce qui m'a bien frappé, c'est surtout la loi sur la biosécurité éditée ici en Ouganda, où le collègue ougandais effectivement nous a exposé.
And I was particularly touched by the law on biosecurity as presented from Uganda.
Et comparé à mon pays, effectivement, nous n'avons pas encore arrivé à ce stade de mettre la loi sous le Parlement pour que le Parlement puisse adopter. Or, nous sommes seulement au début.
And as compared to their country, they are not yet at that level of law development. They are still at the beginning.
Et cet atelier vient à point nommé au retour au pays. Vraiment, je vais prendre ces exemples-là pour exposer, pour nous permettre effectivement de bien faire le travail.
So this meeting is coming at the right time because when he returns to his country, he will have an opportunity to approach the authorities and introduce that.
Et Le dernier exposé qui parlait effectivement de la communication, cela nous a rappelé les différents événements qui s'étaient passés dans les pays par rapport aux les différentes questions posées par la population.
Yeah, and the other expose was on the communication, presenting what's happening in different countries, mostly regarding communication.
Voilà, en résumé, c'est ce que je pouvais dire.
Yeah, that's the summary of what he wanted to share.
Thank you very much, Dr. Hannes. Thank you very much, Dr. Christian. All right, so I see the number of chats online. Does anyone online want to share with us quickly what their takeaway message was from yesterday? You can raise your hand and we'll pick on you. No one? All right. So then let me proceed with introducing our first facilitator for today. Mr. Okea Michael from Makerere Biomedical Research Center. Mr. Okea Michael holds a Bachelor of Science degree in Biomedical Science with focus on molecular biology. He has worked with Anchor Biotech in a number of capacities as their laboratory technologist and now their biosafety officer. He's also a member of the Africa CDC COVID-19 online testization program. And he has also served as a research assistant in a number of capacities and projects associated with the response to COVID-19. He will be facilitating us in the session of risk assessment and mitigation. Ladies and gentlemen, join me in welcoming Mr. Okea Michael.
Mr. Ian, could you help me share the screen? Is it okay for the online participants? All right, thank you very much. Ladies and gentlemen, it's an honor to be before you this morning. I would like to thank Ian for the wonderful introduction. I also like to thank Synbio Africa for this great initiative. So this morning, we're going to be looking at biorisk assessment and biorisk assessment and mitigation. Any facility that handles biological agents, first of all, has an obligation to their personnel and the community to perform a risk assessment on the work that they will conduct and to select and apply appropriate risk control measures to reduce those risks to an unacceptable risk. So the purpose of risk assessment is to gather information, evaluate it, and use it for sorry about that. Yes, yes. So thank you. We're looking at the purpose of risk assessment. One, to gather information, evaluate it, and then use it to inform and justify implementation of processes, procedures, and technologies that can control the risks present. So this biorisk assessment and mitigation, I want us to have an interactive session. I would like to volunteers to share with me their expectations, what they would expect to learn from this. Any two volunteers?
Any volunteers here? You have no expectations from the risk assessment and mitigation? 3 years today? Yes, Mr. Peter.
I don't work in a lab setting, but I'd be more interested, I mean, after looking at it from the localized setting, your thoughts about how it can be institutionalized programmatically, more at the national or regional level. That's what I'd be very interested in.
All right, thank you very much. Any other person?
Yeah, I would be interested, expect to know how, from the introduction and from what you have said, you are in the lab. But how can you translate that into the layman's setting? Yesterday we had about those questions we were answering on the communication and so on and so forth. How is it that, can it be done from a layman's point of view?
All right. Wow, those are very good expectations. This has something to share.
Yes, Professor.
I would appreciate some comments on the quantitative methods of biorisk assessment.
All right, cool. Oh, sorry.
You have one more hand?
Yeah, yes, I have one more.
And how do you ensure compliance?
Compliance.
Yes.
Okay. Wow, those are very beautiful submissions. Yes, so in this session, we're going to define biorisk assessment, risk mitigation, and associated terms. Of course, according to the layman's perspective. We shall also discuss the process, timing, scope of biorisk assessment and biorisk mitigation, and we shall also delineate the stakeholders in the biorisk management strategy. When we look at these definitions, let us have a recap of the pandemic. Before the pandemic came, I'm a staunch Christian, I'm a Catholic. In church, during the sign of peace, offering the sign of peace, would have handshakes. But during the pandemic, handshakes were considered as a risk. This risk, it's a combination of probability of occurrence of harm. You're looking at the chances that harm is going to occur. The scientists had already perceived it that COVID-19 can be spread through handshakes because people touch surfaces. So the probability that COVID-19 transmission would occur is what's known as a risk. So handshaking was considered as a risk. And the process of evaluating this risk that arises from the biohazard and considering adequacy of control of any existing controls and deciding whether the risk is acceptable, that is the biorisk assessment. How the task force was able to know that handshaking exposes people to COVID-19 and how they will go ahead to mitigate handshaking. Maybe they thought it would be through sensitization, and it also be maybe a short-term ban on people having handshakes that they just wave to themselves. Now, the risk mitigation is about reduction of this risk. So all activities that are pursued to reduce and eliminate the perceived risks. So the sensitization, the stopping of handshakes, these are some of the activities that were done. So we're going to look at the biorisk assessment process. How are you able to identify the risk, evaluate it? How are you able to identify what brings about the risk? The very first important step for biorisk assessment processes is identifying the hazard. And hazard identification is a part of this process that is used to evaluate if a particular situation could be an item, activity, if it may have potential to cause harm. Anything that has potential to cause harm is known as a hazard. How do you identify these hazards? For example, could be cautious of your environment. I'm going to try as much as possible to be in a generalized environment, like ours here. Realize that I'm holding the microphone, and God forbid, there can be some kind of electrocution. You get it? So a microphone is a source, or it's an item that causes harm. And the hazard is the potential source of harm. So microphone is a hazard. The harm it causes is electrocution. So you have different types of hazards, especially when you are looking at biological risks. The biohazards, you have physical hazard. For example, maybe you are looking at liquid nitrogen. You're having air conditioners. They have flammable gases. You can look at the environmental hazards. There is lightning, floods, dust. All those are potential causes of harm. You can also look at infectious agents, COVID-19, for example, accidents, even at our workplaces, our jobs themselves, potential causes of hazards. For example, if you, for example, the gentleman who's behind the technology here, the whole day, most of the time is going to spend while sitting, and there are consequences that result from that. So a hazard is a potential source of harm. So you identify hazards by looking at doing safety audits at your workplace, at your institutions, and also getting feedback from users. What are some of the things that possess the potential to cause them harm? You can also do job analysis, and you can also have a record of different accidents that has happened within your vicinity. So after identifying the hazard, which is the potential source of harm, then ask yourself, what is this harm? What are the harmful consequences that the hazard result into? Let us take the example I brought in earlier on, the COVID-19. So the potential source of harm here is handshaking, and the harmful consequence from handshaking was transmission of COVID-19. So you always have to ask yourself what the consequence is. After asking yourself what the consequence is, you come to risk evaluation. Now, risk evaluation is a method of estimating the likelihood and severity of the harm or of the consequence. So it helps us to know whether the risk is low, medium, or high. Remember, a risk is a probability. It is a chance that the consequence that you have identified is going to happen. So later on in our discussions, we shall look at the quantitative methods of evaluating the risks. So after looking at the risk evaluation, usually use a risk matrix. We shall look at how to use a risk matrix that looks at likelihood of an event versus its severity. After identifying the risks, you look at risk prioritization. Now, risk prioritization, you're trying to look at this risk that you have identified, whether you should act upon it first, based on the availability of resources. Whether you should act upon it based on the availability of resources. So you utilize a risk prioritization number, and afterwards you ask yourself whether the risk, whether the risk is acceptable or not. Now, the acceptability of a risk is subjective to value judgment. So there are several factors that can influence risk acceptance. These factors are considerations as the level of available resources to mitigate or control the risks, and say, you know what, let's just compromise this risk and live with it based on the resources that you have. It can also be upon the culture, geographic region, endemicity of the agent. At one time realized that the prevalence of COVID-19 had gone down, so lockdowns were uplifted. So sometimes acceptability of the risk depends on the endemicity of the region of the disease, the value of the work to the community. You are constructing a road, you know there are going to be potential risks, there's going to be dust accumulation, but you know you can accept the dust because of the value that road construction is going to have. So the International Risk Governance Council recommends considering public concerns as separate analysis from the technical risk assessment, because the public may never know the potential harm something that you're doing offers. So you always have to refer to the technical analysis. Yes, here's a risk matrix that we use for risk evaluation. It is a mapping of the likelihood versus a consequence. When looking at likelihood, looking at this consequence, how likely is it to occur? What are the chances that it's going to occur? So it could be rare, a rare consequence that it can happen maybe over exceptional times. It can be unlikely, could happen at some time. It can be possible, where it might occur occasionally, likely, where it will probably occur in most circumstances, and almost certain, where expected to occur in most circumstances. So after identifying the harm, you come and do risk evaluation. Ask yourself, what is the likelihood of this harm to occur? After doing that, after knowing maybe handshaking, it is likely that there will be transmission of COVID-19. Then you look at the consequence. Look at the consequence. Is the consequence minimal? Is it minor? Is it major? Is it severe? For a minimal consequence means that the hazards or a near miss, it requires just reporting and follow-up action. So it doesn't require a lot, just report. Then minor requires potential first aid in case of a minor injury. Then moderate require potential medical treatment, but can even result in an illness. So look at COVID-19 as moderate, but to some, remember, risk acceptance and judgment is subjective. Could be major, potential loss. Look at the time injury, look at the non-permanent disability. Could also be severe, looking at potential fatality or injury. So use the risk matrix to gauge where the consequence lies. If it is going to be, likely, for example, if it's likely and it's most likely to be moderate, where to requires a potential medical treatment, so it is a high risk, falls here, the high risk. If it is unlikely, where it's low, and just requires just minimum reporting, then it is a low risk. If it is almost certain that is going to occur in most cases, for example, if you're attending to an Ebola patient, right? You are touching this person, so it's almost certain you're going to get Ebola, and it's going to result into severe fatality, so it's going to be a very, very high risk. So after risk evaluation, we looked at prioritizing the risks, where you have to utilize a risk prioritization number. And a risk prioritization number helps us to gauge the priority of the risk. Because when it comes to risk mitigation, you'll have to set your priorities. Now, this risk is very high, we must deal with it very fast. It also brings in the question of time, of the timeliness of the action. Because if you delay to address a very high risk, then it's going to cause potential danger within the communities. So this is the essence of the risk prioritization number. And the risk prioritization number, like we've seen, for the category of low risks, and look at the minimal column versus the likelihood. Start with the risk prioritization number of 2 if it is unlikely. In most cases, if it is rare, you give it a risk prioritization number of 1, and come to 3, 4, then 5. So for this minimal category, starting from the rare, which is 1, it means that as you go down, look at the number of chances of the consequence happening, you keep on adding 1 to each specific category. So we started from rare. I'm sorry, my slide was not able to cover that. So rare is 1. You come to low, which is 2. You add on 1. Low, you come to possible, which is 3. Likely, which is 4. Almost certain, which is 5. So if it was still rare and could cause minor injury, you give it 2. And which means that all incidents that are within that column are going to be multiples of 2. So if it is unlikely, it will be 4, 6, and then 8, and then also almost certain, it will be 10. So until it reaches rare, where the potential harm or the consequence is going to be severe, give it 5. And it's going to, and everything that lies within this column is going to be multiples of 5. So start from 5, 10, 15, 20, and 25. So realize that 25 is the highest risk prioritization number that you can give. So you can be able to gauge the risks in terms of priority. The risk that has the highest prioritization number is the one that you give most of the priority. Yeah, so looked at prioritization of the risks, and then afterwards you ask if the risk is acceptable, if it is tolerable, and if the available control measures can be able to mitigate it. For example, I gave some of you use public means of transport. if you're going to come here, you know one of the risks of using a taxi, God forbid, to result into an accident. But you know the accidents are very possible, but you ignore that. So you accept the risk, you board in the taxi, then you come here. So risk, we shall look at what determines a risk acceptability. So timing for risk assessment. When should we do these risk assessments? Speaking out, of course, in most cases, biological risks, most of the biological manipulations occur within the lab setting, but we shall also go out of the lab setting. For example, if there are changes in lab operations, changes to biological agents, maybe your lab was dealing with a risk group 2 organisms. Risk group 2 organisms are ones that have maybe like malaria, the treatment is there. It's now shifting to an infectious agent like tuberculosis. You need to do risk assessment and see if the biosafety level 2 really can be a suitable ground for TB. Or if new information is available on current biological agents. For example, back in the past, we had the SARS. It was not a global agent of it was not an agent of global concern. But after some times in 2019, the pandemic hit, so it became a concern. Changes to personnel, you've brought new personnel into your work field, right? Maybe it is a carpentry workshop. You know how to use those electric saws. Someone doesn't know how to use them. So you need to assess their competence. Then could be changes to procedures and practices. Before the pandemic, during the pandemic, well, it was a must to put on a mask. But right now, it's at will. So you have to do a risk assessment because of that change. If there are changes to equipment within your setting, for example, maybe you are using, let us say we're using solar equipment and now you're going to shift to electricity so that the hazards change. If there are any changes in international regulations, changes to biological agents, if you're at a facility and you're asking maybe people for specimen collection, collect 1 ml of a sample, but then you found out that the sensitivity of your test is low, so you ask them to collect 5 ml of the sample, you are increasing the volume of the infectious agents. So you have to do a risk assessment and many others. You also do a risk assessment. For example, if there is an incident, accident, and be a laboratory-associated infection, hospital-acquired infection. So you want to evaluate identify the hazards and evaluate if the risk is high, if it's low, and then from there go on to risk mitigation. You usually do soft audits. There always are core requirements. For example, occupational hazards. You need core requirements to mitigate those hazards, to solve those hazards. So in case you do not conform to those soft audits, you are predisposing your chances to the risk. Sometimes it's about user feedback. Within your home, your child tells you, Dad, I saw a snake. I saw a snake at home. That's feedback. The snake is a hazard. So you have to do a risk assessment. What's the consequence? How does the snake come about? All those are predisposed as risk assessments. And risk assessments must follow periodic reviews. In most cases, they're annual periodic reviews, and it's a requirement because sometimes we have residual risks that stay. We shall look at this in the next slides. What is the scope for risk assessment? Where do we carry out the risk assessment? You look at the general safety requirements, facilities and design. Where we are here, see there are open windows where you can jump out in case of an emergency. But if you found a room that only had one closed door, then that predisposes you to risk assessment. Look at the maintenance, services. most of the electric appliances must be maintained. In case you don't maintain them, you must do a risk assessment. Electrical safety, fire safety, storage facilities, where you store flammable liquids, gas, PPE, personal protective equipment, health, and then the safety of the staff. All these give you a scope for risk assessment. If you're looking at the diagnostic cycle, you have to look at the pre-analytical, analytical, and post-analytical procedures. For employment, occupation hazards, look at the staff job hazard analysis, especially the ergonomic stressors, which are any force that is required to complete a work. It could be in terms of psychological, it could be in terms of static postures or seated for a long time. Look at also your environment. It is raining. Are there any stagnant water around you that predisposes to mosquitoes? The other, you have to look at biosecurity considerations. Yeah, and the biosecurity, we are looking at measures that aimed at protection, control, and accountability of valuable biological materials and protection of other valuable items to prevent their loss, theft, misuse, diversion, and also unauthorized access. So you have to do risk assessments and see if there is a high risk of theft, if there is high risk of unauthorized access, etc. So having done your risks assessment, you come and do the biorisk mitigation process. Now, to mitigate risks, remember you have so many risks that you have identified, so we need to prioritize them. That's the essence of the risk prioritization number. So you need to rank the risk priorities. Afterwards, you analyze the risk. How does this risk occur? How does this risk occur? For example, going back to the example of COVID-19 in churches, one of the other risks could occur if people came to the church with unwashed hands, right? So they would do handshakes. So that knowing that unwashed hands is the underlying principle behind transmission of COVID-19, it predisposed churches to come up with sanitation points, sanitizers to the congregation before they enter. So analyze the risk. How does it occur? Because its occurrence gives you ways how you are going to mitigate it. After analyzing the risk, you choose and describe an appropriate risk control measure and mode of risk communication. This communication was tackled yesterday. After choosing the appropriate risk control measure, you outline the resources that are required and assign the implementers of these measures, and you must give them timelines. For some risks, they're high, they must be mitigated within the shortest time possible. After mitigating, you must have a review, monitoring and evaluation. Review the measures and identify the residual risks. Now, residual risks, these are risks that remain after institution the different risk control measures. Back to the COVID-19 example, yes, handshaking was forbidden, but still the congregation would still be predisposed to COVID-19 in case there was no social distance. So there was still a residual risk even after banning handshaking. So you have to do a risk assessment for any residual risk that remains. Now, in most cases, when you are doing the biorisk mitigation process, you adopt the PDCA model, the plan, do, check up, and check approach. So you have to review the risks. Has the possibility of an exposure become less likely to happen? Have the consequences become less severe? Have the likelihood and consequences been reduced so that the residual risk is acceptable? And if no, are there any additional control measures that are available? Should work proceed or without the risk control measures? And then ask yourself, who has the authority to accept the residual risk and approve the work to go ahead? How should the selected risk control measures and subsequent approval for work proceed to be documented? Yeah, so how do you choose these risk control measures? So for a low risk, it means that the likelihood, it means that a consequence is unlikely. Remember the risk matrix, it is unlikely and it poses negligible harm. So the risk is acceptable and it's managed by well-established and routine processes or procedures. Then if the risk is medium, a control plan must be developed and existing controls need to be reviewed, and the target resolution is ideally reduction to low-level risk should be done within 6 months. So if it's medium, your controls should look at putting it at a low-level risk. A high risk requires immediate assessment and senior staff consideration, and the control plan must be developed, regular monitoring and reporting to relevant management, and also target resolution should be done within 3 months. Look at putting it a low-level risk. An extreme risk or very high risk requires immediate assessment of the senior staff, and a detailed control plan must be developed, and consideration should be given to ceasing the activity unless the risk can be reduced to a lower level. It is extremely very high, just abandon the activity. And regular monitoring and reporting to relevant committee is necessary, and the target resolution should be within 1 month. So whenever you're assigning implementers, you must accompany with a timeline, basing on 1 month for extreme risks and 3 months for high risks. So the hierarchy of risk controls. The hierarchy of risk controls helps us to understand which risk control measure is most effective. So you look here coming from most effective to the least effective. Because most effective, you want to do away with the risk completely. So you can say elimination. For example, if you have maybe a thick bush around your home and it breeds mosquitoes. So to eliminate that hazard, you have to slash away the bush, put away the bush. So elimination is the most effective because you are completely dealing away with the hazard. The other is substitution. You replace a hazard with a less dangerous one. Back in the days, people used to use asbestos roofs, but asbestos predisposes to cancer. So they had to substitute asbestos roofs to iron sheets to a less risk methodology. Then the other, you can redesign and change a machine or work processes to make it safer. This can also come in a sense like this one, in case, God forbid, there is a fire outbreak and there are no emergency exits. So when you're doing a risk assessment after such an incident has occurred, you redesign the facility and you put emergency exits. It can be isolation. You separate people from the source of the hazard. In case there is a fire outbreak here, there must be a fire assembly point where you are evacuated from where the danger is. And also look at administration, putting rules, signage, or training in place to make sure that workplaces are safer. For example, at a petrol station, there are flammable liquids, so you are not allowed to smoke. At a petrol station, you're always asked to switch off an engine. So those are some of the rules. So you look at administration. Then the other is the personal protective equipment, or the protective clothing and equipment. You are a border rider, you know that you are always exposed to maybe road accidents, but you can decide to eliminate the risk by quitting the job. Or you say, let me just get personal protective equipment, which is less effective, but the risk will still remain there. That is the hierarchy of controls. Then the other, looking at matching the risks and then the appropriate control measures. So we have this beautiful pictogram showing you the likelihood of the consequence and then the severity of the consequence. It's negligible, moderate, severe. Likelihood, we're looking at rare, very unlikely, the increment of the factor of likelihood. So if the risks fall in this green, which is mainly the very low to low risks, because the likelihood, the severity is negligible, sometimes can be moderate, so they are very low to low risks. You look at the core requirements. The core requirements of your, for example, the planning, facilities, and design. What are the requirements that are required for you to start up something? Then from there, if they are medium to high, for example, if the likelihood is really high and also the severity is severe, then you look at heightened control measures. So look at sophisticated control measures that you can put in place. You can look at substitution, you can look at redesigning. Then if it is very high risks, here where the likelihood is very high and the severity is really very high, particularly those risks that are associated with catastrophic consequences, you have to use maximum containment. For example, you restrict the people. If we had an Ebola unit here, it would be really gazetted off from the public. Or if we had, especially when you go to the military and looking at the ISOs, the measles, because anytime they can explode, they're usually kept away from the staff quarters. So that's how you match the risks and their control measures. So in summary, by risk management is a summation of risk assessment and risk mitigation. So describing work activities that you do at your facility helps you identify these hazards, and then you determine the risks. Remember, risk is probability that the consequence from these hazards will occur. And then you decide whether the risk is acceptable or not. If it is acceptable, then you can be forced to work and monitor control. If it is not acceptable, you can choose the elimination risk control. You can revise or close the project. You cannot do that because source of income must continue. Then you have to prepare a risk control action plan and implement the control measures, and then review the adequacy of the plan. You review the adequacy of the plan and there's still some risks that remain, the residual risks, then you have to ask yourself whether the risk is acceptable or not. And then from there, you do the risk assessment. So this by risk management brings us to the stakeholders for the by risk management. So a quality risk assessment indeed is a culmination of input from various people in the laboratory and the facility. And these requirements are indicated in the ISO 35001, which entails the by risk management system. So in the first instance, you must have a by risk management policy at your facility. It should communicate to us after how long are you going to review your risk mitigation measures. It could be after a year, it could be after 6 months, and it should stipulate the different roles that people have to do. And these different roles are categorized into top management, senior management, and the by risk management committee. So for the top management, it has the ultimate responsibility for the organization's by risk management, and it cannot delegate this responsibility to anyone, and it must ensure availability of resources to ensure establishment, implementation, and improvement of the by risk management system. So this could be like the board of directors, the proprietors, the ones that determine what resources a company has to utilize. Then 2, you have the senior management, which shall be designated with operational responsibility for overseeing the biorisk management system and ensuring implementation of the operational function of the biorisk management system. Someone there asked about compliance. So the senior management has to put in place compliance rules and put in place the different signages and the rules that must be followed by the staff, make sure that they're not exposed to this kind of risks. And in most cases, it's better to adopt the culture of documentation, to come up with an incident form. In case someone has been exposed to something, you write it down, and then you do what we call a CAPA, a corrective action and preventive action, where you do a root cause analysis, how someone has been exposed to that, and thereafter you come up with a preventive action. So it is the role of the senior management to do all this. Then the biorisk committee, it's a representative of cross-section of expertise, could be researchers, could be consumers, visitors to your facility, the workers themselves, and it's appropriate to nature and scale of activities that are undertaken. And it ensures that issues addressed are formally recorded, including assignments, tracking, and completion of all actions. So this is what constitutes the biorisk management committee. So for this discussion, the useful resources, look at ISO 35001, the biorisk management system, ISO 15190 for medical laboratories requirements for safety. These ISOs are really very expensive to acquire, but laboratory biosafety, biosecurity risk assessment, technical guidance, laboratory biosafety, this technical guidance document, which was adopted by the International Biological Threat Reduction, the SANDIA National Laboratories in collaboration with the International Federation of Biosafety Associations, is available online. The SANE Workshop Agreement, WHO Laboratory Biosafety Manual, and also the EPHL Risk Assessment Best Practices and Examples, issued on May 5th, 2016, is a useful resource to enable you carry out risk assessments and mitigation. Thank you very much for your kind attention. I would invite the floor to any questions.
Thank you very much, Mr. Maiko. I read the question here.
Thank you so much. I guess, first of all, thank you for the very good presentation. And like I mentioned earlier, it makes a lot of sense at the lab or at the individual level. But I guess, for example, if we are dealing with a potential global catastrophic biological risk causing pathogen, which might even be an engineered pathogen, there are all these other issues that have come up in the previous days, such as dual use research and things like that. So I really wonder, before even these things, these researchers have actually kicked off, traditional IRBs, if you see the ethos behind them, it's, you know, a community member, some like a priest or something, but it's not very much from the technical ability to evaluate biological risk associated with running a particular project or research. And we can't ideally say all this work is for you and for the Uganda National Council of Science and Technology. How many researchers happen in Uganda? Every week, every month, every year. So I guess for me, my question is, what are some of the ways that we can start to build biorisk assessment into the upper levels, into the IRB reviews, or even on the funder side, maybe the funder requiring some kind of a letter or a report that a dual use threat assessment has been carried out, and we are satisfied that this research poses minimal dual risks. Thank you.
Okay. Okay, let me take on that. Thank you very much for that observation. As far as research is concerned, there's a requirement of good clinical practice, the GCP, and part of the review by the RRBs is to look at the standard operating procedures of your study, which is the policies, and also you're supposed to inform the community of the risks that are associated with your research. And in most cases, when you're doing, when you are seeking consent from a study participant, you have to inform them about, the risks that is associated with your research. So you're supposed to do the risk communication, give someone the opportunity to make an informed consent as regards to that. So adopting this has to be strengthened at the IRBs through advocacy. I know the different organizations that have started up, especially looking at the research ethics in our country. So biorisk assessment should really be adopted as far as this is concerned, because if it is not, you are most likely to expose the population to a biological risk. For example, if you are doing, carrying out genetic modification of a pathogen in the lab to try to study its pathogenicity, and this is exposed out of your lab, and go ahead and also confer antimicrobial resistance. It also increases infectivity. We have seen polio associated to the live attenuated polio vaccine as a result of that. So we need to do a thorough biorisk assessment. One thing that I've encountered is that we don't have a specific protocol that entails all these processes, that integrates all of them to one that can be adopted everywhere. The ISO has just been developed recently, so we do not have, sometimes it requires technical abilities and training, so the WHO has to really come up and harmonizes these protocols, especially the risk assessment tools. What safety considerations are you going to consider? What equipment are you going to consider? Yeah, but it has gone ahead to characterize especially biological agents that you are going to deal with in different risk groups, risk group 1, group 2, group 3, and group 4, and further categorize the biosafety levels where you have to handle most of these. And also gone ahead to ask the staff that are manipulating with these kind of organisms, at least to take protective measures. Designing the PPE that you have to use, and also the immunization requirement for that. But that is really a very big issue, especially as regards here to Uganda. Thank you.
Okay, we shall take Dr. Robert and then the hand online.
Thank you, Michael, for this a very good presentation. Now, I just want to ask you that really, what is happening on the ground here, for example, in Uganda? Are there any challenges that you have found out regarding the implementation of this biorisk assessment? I was talking to, I have friends who are in the lab, and we're discussing COVID-19, you know, production of vaccines in Uganda. And some were saying, no, we cannot produce a vaccine here because we don't have the capacity in terms of the infrastructure, maybe the BSL-4 lab. And the person who is in the lab told me, we handle these organisms in our labs. Then I was asking myself, do they really do a risk assessment for these organisms before they handle them in their labs? See? So I just want you to, to share with us some practical examples of some of the challenges in the implementation of this, because it's very, very critical. You know, we can read about it, present, but what is on the ground really is very, very important. Otherwise, we shall be exposed to, you remember the MP was saying, the one who is challenging the vaccine, the COVID thing, he said, we can't produce this vaccine here. Thank you so much.
Okay, thank you so much for that observation. As you know, we are a low resourceful country, and most of these are international standardized organization requirements, ISO requirements for laboratories and different organizations dealing with valuable biological materials to adopt. But we have what we call an audit, external audits and accreditation of those facilities. It really requires a lot of input, monetary input, and it is the task-long processes. And given the fact that most of the facilities have been taken on by the private sector that are money-minded, most of these requirements are not actually put. So it still comes back to the government policy that we have to influence and make sure that maybe we can come up with our own accrediting body. The Kenyan people have the KENAS, SANAS, the South African people. In Uganda, we do not have one. So you realize someone has to pay over 40,000 US dollars, someone from South Africa, come and see if your facility has got the requirements and then gives you the accreditation to do that. But this is really a very serious issue. We usually have medical waste that is generated from these facilities, and it is not segregated. And it is combined with domestic care waste, and you find it in all these dumping sites. And people are exposed to all those kind of sicknesses. Some of these labs have maybe worked on people that are infected, but we don't have a surveillance mechanism, a robust surveillance mechanism. It has only been adopted with COVID, so that if you find someone that is positive for COVID, the Ministry of Health knows. How about if you encountered someone with Marburg, with cholera at that particular time? So there isn't a surveillance mechanism, because if such happens, then you straight away come up with containment measures. So we still have a lot of work to do. I also think the biosafety and biosecurity aspect has not been well adopted by the ministry, and it's really very fundamental.
Thanks very much. Very thorough presentation. Now, from your uses at the time, there are, of course, some limitations that you face. How, in the event, for instance, that you're facing another scenario as was faced in the spring of 2020 with COVID-19, you have policymakers, including officials in public health, who are fully aware of what the risks are now, because they have seen the deaths, they have seen the economic dislocation. But even after seeing the consequence flowing from this, the investments are still not being made. How does the scientific community elevate these issues? What kind of levers do you think exist on your side of the fence that can perhaps help with the sensitization process for policymakers? Because I think that it is clear that you're not seeing the groundswell of engagement yet on the policy front equal with what the risk reality is currently.
Okay, thank you so much. So I'll take you back to the hierarchy of risk control measures. Looked at elimination and substitution and everything. Realize that the education or literacy levels are increasing and people are aware of all these kind of risks. But then there is the impunity, the laxity for them to inculcate a culture of biosafety. And in most cases, people tend to remember this useful information that is sourced out to them is after an occurrence has happened. And yet the culture of biosafety, it has to be proactive and not reactive. So when you try to study this whole situation of the pandemic, what a scientist had to do is, first of all, people have to go and work, people have to associate, we have to come for this conference. So what do they have to do? They had to look for medications that at least reduce the risk to low level. Then they also had to look for the vaccine. The vaccine was instituted and available. So, but the vaccine was developed. We have been shipping 1 million doses of vaccines, and we have not yet started making vaccines. So we do not know if we had a thorough presentation during the clinical trials of these vaccines. So we do not know their effect on the African population because of our slight genetic dispositions that we have. So it can still be a risk that we shall wait until conditions start surfacing, and then we shall remember, go back and try to study about all this kind of thing. So one thing for sure I know is that a lot of Ugandan scientists have participated in coming up with these preventive measures, even trying to assess the uptake of the control measures, even the beliefs, the different belief system. And really science has been appreciated in this pandemic. It has actually silenced a lot of conspiracy theories. It has really been appreciated, both at the government level. So more funding is coming in. So this has been an eye-opener. So we hope that with more research interventions, we can be in position to mitigate this. Yeah.
Thank you very much. We have a couple of hands online. David, you can unmute and ask your question.
Thank you, Michael, for the good presentation you have given. Are you getting me?
Yes, we can hear you.
Thank you, Michael, for the good presentation on risk assessment. One thing, there is somebody from Uganda who had a concern about people handling COVID, and yet they don't have the facilities. There's one thing which we have to understand about the risk assessment. I was working with the CDC, and we were handling TB. And when we did a risk assessment, because we were just doing smears, we found level 2 labs can easily handle that. But a time came when we had to do cultures, which means now we are dealing with a bigger volume. And during our risk assessment, we found we needed to have a higher facility, that is BSL-3, which, lucky enough, CDC had enough money, we constructed that. So the same with COVID. There might be people handling COVID, but there are also other aspects we have to consider. The procedures. If your procedures are highly refined, you can handle some of these most dangerous pathogens in level 2 as far as your procedures are highly refined. The facility design is the second, and then as the hierarchy goes, PPE is the last. So my comment was, maybe if there is an organized way of controlling the COVID handling in facilities in Uganda, then the risk assessment can say, are we able to handle this or are we not able to handle this? Thank you.
Okay, thank you, David, for that submission and commentary. Yes, we need to adopt maximum containment measures, especially to make sure that these biological agents that have been put out of the public, they do not surface again in the public. Case studies that for the smallpox virus, when the smallpox was phased out, all laboratories that were dealing with the smallpox were asked to submit all the samples that had smallpox virus to one laboratory in the US. So we need to have mechanisms where we strengthen national correspondence, especially of these biological items. And as I've told you, there's a lot of informal sector as far as the health and research is concerned. So most of these procedures are not adhered to, which is still a gap that we have to solve. Thank you.
Thank you very much. We have another hand online. Geoffrey Jagero, you can unmute and ask your question.
Thank you. Thank you, Michael, for your presentation. And good morning, colleagues. Mine is really not a question. I have a couple of comments that I wanted to make just in support of the responses that Michael has provided. I'm glad that this is bringing together colleagues from different countries. And by and large, within the context of risk management, most of our challenges are basically the same. I want to look at a few issues that are pertinent to risk management. One, the question one wants to ask themselves, does your country have legal and regulatory framework in which a bioscience is conducted? Is there an overarching law that guides and regulates bioscience in your country? And that has always been a challenge in most of our African countries. We do bioscience, particularly when you go back to the legalities, there's hardly right bioscience. Number two is the gap between policymakers and implementers. Implementers, yeah, I mean the heavy lifters, as the scientists who work in the lab, protocols to seek IRB approvals. As long as the policymakers are not so much aware, as long as we've not created sufficient awareness amongst the policymakers, understand really what bioscience is about, what biorisk management is about. We'll always encounter the challenge of even resource mobilization. So one, regulatory framework will give you a guidance even in terms of the levels of responsibilities from top government, private sector, researchers, and everybody who is a stakeholder. They to guide clearly how resource mobilization is supposed to be done. And then your policy framework would be speaking to issues that Mike has already alluded to, issues such as accreditations, whether they're by local bodies or international bodies. Your policy framework should provide guidelines for practice, implementation tools for risk assessment, or applying the current AMP model. Your policy framework should provide training mechanisms. You have a locally developed training curriculum for biorisk management. Your policy framework should speak to awareness among the policymakers, among the implementers, the private sectors, governmental institutions, researchers, and even the communities, so that everybody is on the same page. And then that way we'll be able to we'll be able to attract and put together the resources that are required for biorisk management. We'll be able also to ready our laboratories and our bioscience environment for emergency response in the future. Unfortunately, the emerging or re-emerging threats, health threats, now and into the future, will not cherry pick, and Africa is not ready in terms of emergency response. So let's go and attack Europe or North America or whichever country for that matter. They are here with us. These threats are here with us. I think it's high time that we start engaging seriously at governmental level, non-governmental level, private, and research community and all the stakeholders involved, so that we can address these issues. And lastly, because we are not all at the same level, you'll find mostly that some countries have gone a little bit ahead of others in terms of the implementation of biorisk management. So we can always benchmark and learn from each other as the neighboring countries, especially within the EAC as we move forward. You do realize now the EAC has brought on board our brothers from the DRC. What does that mean to the health threats currently as opposed to it means that if there's a flare out in the DR Congo, it would probably move much faster into the rest of the East African community because of open borders. Are we looking at these issues on the broader aspect of response and getting our laboratories ready? And the full implementation of biorisk management is just one of the ways in which we can get ourselves ready. Thank you, and back to you.
Okay, thank you so much for that submission. Indeed, collaboration and surveillance is very, very, very important, but also enhancing compliance to the established guidelines by different government or parastatal bodies that are concerned with biorisk management. So I'd highly commend that. And one of the practices that has been adopted is issuing out practicing licenses to different laboratories, but something that needs to be strengthened is doing periodical audits, external audits for all these laboratories, especially safety audits. Most of the audits fall under quality. So to make sure that they conform to the required standards, so that we don't have other hazards surfacing. Thank you.
Thank you. We have one more hand online. Fernand, you can unmute and ask your question or comment.
Yes. Thanks to the presenter for a wonderful presentation. I did enjoy it. Yes. I'm supporting your point on the fact that we should innovate a little bit the risk assessment procedure and that adopt it in our context. Like Uganda and one has to come up with their own. And if you really want to come up with this, shall we call it innovation, I think we may need to bring also what we call a host range analysis. In fact, when I'm talking about host range analysis, I'm referring to bacteriophages. Bacteriophages, we can obtain them from sewage samples. Bacteriophages are viruses that kill bacteria, resistant bacteria particularly. So we can actually isolate them from sewage samples. I wanted to collect sewage samples from, should I call it sewage sample, but waste sample from hospital, and then use clinical isolate to isolate the bacteriophages, but I couldn't really have access to that waste samples because of biorisk consequence. So, but I think if they really allow us to assess that sewage samples or waste samples, I'm sure that we are going to isolate phages, which can actually kit resistant clinical clinical isolates, which are actually handled in the lab. Yes, because I isolate the phages from sewage samples, and actually I also got clinical isolate from hospital, And then when I tested, we got whole range analysis. When I tested it, I realized that the phages were actually killing those clinical isolate from hospital, highly resistant, carbapenem resistant cane moniae, for instance. So you see that we are really exposed when it's come to biosecurity issues. So it's really important that maybe we can really incorporate that host range analysis in that protocol. But my point is not there. My question to you will be more practical. It's about implementation of those protocols that we are having. You for instance, you all the protocols, all the guidelines there, and the lab technicians or the biomedical scientists they are aware about the protocols. But one day you see them, you go in the lab, you see that some of them are not in the lab coat, or they are not even wearing gloves, and they are actually handling resistance bacteria. So you try to bring awareness to tell them you need to do it that way so that you are not exposed to risk. You see, they are now, it seems that you are frustrating them. So I would like to ask you, because someone presented on risk communication, how could you communicate that biorisk? Is it biorisk assessment to them so that you don't frustrate them? You don't keep frustrating them. That's my question.
Okay, thank you so much for that question. Like I said, when you are implementing biorisk management strategies, you have to follow the PDCA model, the plan, do, check, and act. So when you are planning, you have to look at which risk control measure you're going to take and what resources you are going to harness. Then doing is the implementation, which has to be time-bound. And then checking, you have to look at the adoption of the risk control measures. And you're supposed to subject your risk assessment to periodic reviews. The reviews, we are looking at some of the residual risks, and maybe some of the residual risk is due to the attitude problem, or is due to a belief kind of thing. Then you have to look for alternative ways of addressing the risk. Remember, we are not living in an utopia world. So risks will always be there, but the most important thing is to reduce them to low levels of risk where they do not pose significant or extreme consequences or fatality consequences to mankind. So sometimes it could be because of the belief system that people have. For example, when you still come back to the Catholic belief system, they're against condom use. And yet condom use is one of the contraceptives that is looking towards prevention of HIV transmission. So you have to weigh in consideration with that. Can you go ahead and bring alternative methods that people can utilize to avoid that kind of risk? And this is where everything comes down to the biorisk management system, which consists the top management and then the senior level management, which needs to consist of an experienced person in that particular field so that they can lend expertise. So I would conclude by saying that biorisk management, it is a field that is subject to research and innovations, especially as far as looking at attitudes and beliefs among even the healthcare workers, the professionals on adopting all these kind of measures that have been adopted. So once we go ahead and collect all these kind of things, it can inform the policies that we come up. But also, like I said, we need to support our resource bank by designing risk assessment tools that can be adopted by everyone so that we can be in position to offer compliancy and also standardized practices. Thank you so much for that question. It is really, really very eye-opening. Over to you, Ian.
Thank you very much. Geoffrey Jagger, do you still have a question or you just forgot? Okay, all right.
So legacy.
Thank you very much. So, do you have any other question here? Okay.
Thanks, Michael, for the presentation. I want to know how I can know it's the right time to do a risk assessment for the pandemics or pathogens that maybe start with the mild symptoms, just a normal seasonal flu, suddenly become a pandemic. So what is the role of the risk assessment committee on this scenario? From unclassified pathogen, and then it become a pandemic. Thanks.
Okay. What's the role of the risk management? So first of all, the risk management, because the people that deal with this kind of pathogens are very valuable to the healthcare system. We don't want to have that kind of scenario where we are losing researchers to a pandemic. We lost some very instrumental doctors to the pandemic as they tried to look at it. So the risk assessment, first of all, offers protection, looks at getting protective measures for you as a person. But most importantly, it also, it is one of the factors that enhances continuity of work. You get it? Because whenever you do a risk assessment, you're going to identify the hazards and you ask yourself, how am I going to avoid it? But sometimes you are forced to deal with it. You cannot avoid it because it is part of your work. So how does the risk assessment help you to do that? So there are always personal protective equipment that are available. But most importantly, you need to know the pathogenesis of that particular microbe that you are dealing with. When you know the pathogenesis, you know how it enters your body and how it can trigger off a physiological change in your body to become pathological. So by understanding that, you're in position to know how you're going to prevent it from entering your body. Or if it enters your body, can your immunity be boosted to overcome it? So all those are the different research avenues that scientists should be looking at as far as the risk assessment is concerned. Because the risk assessment is useless if you don't come up with control strategies. So it still comes back to science, and science solves problems. Thank you.
I just want to supplement what Mike has just talked about regarding a risk assessment. It's very, very critical because most of the time, maybe you may not have the capacity to handle some of the challenges that may be posed by the organism itself. So you need to really understand the organism in terms of its pathogenicity, its virulence, and things like that. And then this will guide you on what level of biosecurity you need to put in place. Because you remember, of biosafety that you need to put in, biosafety and biosecurity that you need to take into consideration, given the circumstances. That, for example, I was talking about now the COVID-19 and then versus the laboratory capacity that we have in Uganda. Was a risk assessment done, to inform the decisions that are being taken in as far as manipulating the organism to produce a vaccine. I just want to give you an example. I don't know, maybe some of you know how Marburg came about in Germany, that outbreak. It was in the lab. It was in the lab in Germany. And do you know what was going on? It was the monkeys, rhesus monkeys, which were taken to Germany to study a polio vaccine. And what happened afterwards? It is Marburg. And it's one of those diseases that that have affected us for some time. So a risk assessment is very important and it's key, and it's one thing that you always need to start with to avoid such calamities. Thank you so much.
All right, and also WHO recommends that in case there is a new infection, it has to be treated as a risk group level 4 organism, because little is known about it. So it must be handled with maximum containment measures until information is known about it and how to manipulate it. But also his concern is really very good. We have the Cas-CRISPR technologies that are coming up, and there is this concept of designer babies that is coming up, looking at genetically engineering babies, where they do a gene knockout, maybe that can confer a hereditary disease to you. But the CDC and WHO have not yet approved it because they do not know the potential consequences of that it would offer in the afterlife of that. So in case something is not known, it's put at maximum containment measures until there is enough information as regards to it.
So this one is not only for the presenter, but like for everyone here, just to stimulate your thought. So over at the COVID-19 Command Center, when the pandemic had just begun, that was around January. One of the things we pushed for was for the general whole of country lab capacity building to be able to do COVID testing. And the counter argument at the time was that if SARS is a select agent, then SARS-CoV-2 is a select agent, and this probably work to do with SARS-CoV-2 should only be done in biosecurity level 3 or 4 labs, and hence there's no need to spread this kind of thing. But fast forward to where we are now, almost every institution that can remotely link itself to being a lab ended up doing COVID-19. Even airports where initially IATA regulations would never have allowed you to put a lab in an airport, or at least doing RDT testing. So for me, my question then is, like I told you in my presentation on Tuesday, these CGBRs are hypothetical scenarios. How do we balance bio risk assessment, mitigation, and regulation in the context of a widespread CGBR? Because you have this disease whereby you want the knowledge and skills on how to test for it, identify, characterize it, to be widely spread such that testing does not become a limiting factor. But at the same time, these very knowledge and skills you're passing down the chain have very high dual use considerations. And even just look at pathogen security. How many COVID-19 samples are currently presently stockpiled in Uganda? Can we put that figure down on paper and account for every COVID? We are not even talking about Marburg, just COVID. Do you know some of those institutions collapsed? The guy ran, registered the lab to cash in, in the COVID bonanza. What happened when these institutions collapsed? Where did all those samples go? Because when you have a CGBR, you're not going to tell everyone, no, let's test 2 people every day, because if some wrong actor gets it, no one wants to hear. The politicians will first of all say, you guys have no regard for human life. So we need to think about scalable, flexible. It's a systems issue, because everything is there, the ISOs, the bodies, the organs. But are you telling me that in that scenario, we are going to say, submit a dual use request form, go to the IRB, no, we need to think of mechanisms that will allow us to be able to do biorisk assessment on the fly, assessment, verification, certification of some of these institutions. Because let's be realistic, during the COVID-19 pandemic, who was certifying many of these institutions? institutions that were opening up, who was doing their sana, so their, who they would open and they were being given RDTs, districts were being for our stabilization of COVID-19, VHTs should start doing swabs. Village health teams, these are community health workers. You want to give the guy COVID test kits to go and do swabs. You get what I'm saying? So sometimes we, the scientific community, sit in our silo. A teacher once said that you tie millstones on people's necks when you yourself do not carry the words, and you have your lists and you have your categorizations, but are they practical to the current Uganda, let me say, our countries as they are now in the height of the COVID-19 pandemic? Are you going to tell guys, let's consolidate all COVID pathogens in the country? Where are you going to put them for the security of that place? You get, so it's just food for thought that our ideas, our concepts, our theories really have to be grounded in reality. And we have to ask ourselves, what's the practicality of some of these things? Do you really, someone mentioned the 2014 US thing where smallpox samples were found in a cupboard. You may think that that thing is so far away from where we are in Uganda, in East Africa or in Uganda or wherever. But let me ask you guys, which government is going to give you $1 billion, US dollars to go and build a biosecurity level 9 grade storage facility for all the COVID samples? No, they are not. Many of these things you're going to hear near misses for the next 20, 30, 40 years. When you inherit a building from your dead relative and you find at some point during COVID, this was the lab and in the store there are samples and some of them are still viable. So how much are we rooting our thoughts or our ideas in reality? Because when you do not give politicians viable options, they'll say, thank you so much for your presentation, and then move on to the next guy who's shouting about climate change, asteroid.
Hello, how are you?
Online, please make sure you mute.
Can you hear me? Hello, can you hear me? Hello?
Yes, we can hear you.
Okay, thank you. I just wanted to make one or two comments. One, like I said, some of the challenges that we face within our countries are also different. I want to address myself to one of the questions the speaker has just raised in terms of COVID testing. This question came up even in my country, Kenya, a couple of times. Where were all the samples tested for COVID going? And more importantly, where were all the positive samples, COVID positive samples ending up once the testing was cascaded down to provincial level or district level laboratories? Then we did realize from that point that we didn't have a guideline for archiving biological materials in the country. So by and large, we realized, hey, COVID is not just COVID. COVID has pointed us to some of the glaring gaps within our biorisk management framework as a country. And we're asking ourselves several questions, how to address those particular gaps. It is good to have a guideline that enables people to store biological materials, whether they are diagnostic or research. But then we also have to address ourselves to two issues. One, as a country implements total biorisk management practices, we are also trying to comply with international obligations, such as the UN.
Mr. Jagero, you have lost me.
Essentially,
You can proceed, Mr. Jagero.
that my brother has raised is common policy that would guide us moving. That would guide us moving. That would guide us moving forward, even post-COVID. So, like I had mentioned earlier, some of these issues that we are raising, we realize are pointing to clearing gaps within our policy frameworks. So if you have a policy that guides all these issues as a country, then people will not be asking themselves, how much samples are we supposed to store after testing? Where are we supposed to store them? Who is supposed to be responsible for them? And these are issues that can, by and large, be addressed through a policy framework that guides everyone, that everybody needs to comply to as we strive to comply with national obligations.
Thank you very much, Mr. Jagero. Would you like to comment, Mr. Okea, on that?
Yeah. So issues have come up on the practical ways that we can utilize here. One of the things that is stressed out is maximum containment measures. Make sure that VBMs, valuable biological materials that have been isolated from the public, not leak out of the laboratory to go to the public. So it still comes back. You realize most of these samples that come to the facilities, at one point they have to be disposed out because the storage space is not enough. And it still comes back to the waste disposal and methods of waste treatment. Have these basic requirements been instituted at all these kind of laboratories? For instance, laboratories have an autoclave, may not even have an autoclave, but you can also use disinfectants, 1% sodium hypochlorite. All these can be in position to treat the waste and also maximum containment measure that we must make sure that the low resourceful areas, they can adopt. And in addition to that, we need to advance the concept of biobanking. We have the first biobank at Mulago, courtesy of the H3 Africa. And this biobank is storing most of the samples that come from different facilities. There's also one at CPHL, the Central Public Health Laboratories, that's available. So if we have these biobanks taken to regional levels, it also, because of the distance issue, it helps people ease access to these biobanks, and they can be in position to implement the maximum containment measures. Then the other is about hypothetical risk assessments into practical models. We can always do retrospective studies for different pandemics that happened. For example, influenza. We do systematic reviews to ascertain the different lessons that were learned, and also look at different variables in meta-analysis. So we need to also go back and try to review what was done before so that it can give us the yardstick to inform the future. Thank you very much.
Thank you very much. We shall take one last comment from Mr. Hamilton, and we shall close off that session for now.
Thank you, Anne. So I go back to the era with which I'm most familiar, of course, which is the policy framework and the legal aspects of this again, and just how to do the necessary integration in and have a credible process that certainly allows government and other related structures inside of the country to treat with these issues with the priority that it deserves and essentially have a hierarchy, if you will, of engagement that is commensurate with the reality. From where you sit again as a scientist, you're looking in Uganda at the Ministry of Health, primary responsibility, obviously, of thinking through and proffering some kind of a policy framework construct where this process will, one, be highlighted, and two, be focused on in a very credible way, given, again, where the risks are. Is there a role, again, for the scientific community, for component entities like SynBio Africa to be a node in that process? Because remember, the ministry, they're dealing daily with frontline issues. They are out in the communities, and often, as you know, Michael, it doesn't give you a lot of space to actually think proactively. Is this partnership existing? Is it developing? Where, again, as I said, entities outside of the governmental structure, maybe in academia, entities like this, for instance, or others that you're associated with, can be infusing the policy process with the kind of urgency that it deserves. Because, I mean, let's be clear. It's not that officials there, certainly on the policy level, even those that have a public health background within the policy level, are not cognizant of what the risks are. But as you said, you have only a specific set of hands doing a specific set of tasks. And as a result of that, people tend to be continuously distracted. So how can these entities, again, play a supporting role to advance this process?
Okay, thank you very much. I think platforms like SynBio can always look out for supporting partnership with the Ministry of Health, especially to do with policy frameworks, monitoring and evaluation, doing policy review as regards to biorisk management. But then also, you know, funding is involved. Still comes back to the priority and the most stifling issues at present. So you ask yourself now, for a pandemic, most of the investment, it's going to be into elimination research, and instead of the biorisk, instead of the biorisk assessment. Most of the research funds are channeled towards the vaccine development, unless it's put in the biorisk. So at the end of the day, biorisk assessments help us know the problem and how to deal with the problem. But in most cases, it's to do away with the problem means now the biorisk assessment ceases because the potential source of the hazard is no longer there. And that's where most of the efforts are being channeled into. But we have, for example, infectious diseases continuing, especially when there is an outbreak, preparation for a pandemic. You need to establish resources and how they're going to deal with all that. And that's where biorisk assessment is really important. Like we showed you the scope of biorisk assessment, looking in case there are changes in the pathogen, changes in the virulence of the pathogen or the endemicity. That's when the biorisk assessment comes in. And this is what will go ahead to form, to inform the policymakers because the policymakers, they themselves, they want to make sure that the population, the citizenry, is safe from the hazard. So by coming up with all those different control measures, they come and then they look at which one they are going to adopt and they'll implement that. But then at the end of the day, when you look at the hierarchy of controls, most of the resources are going to be channeled to elimination, developing of vaccine, treatment. So you see lots and lots of clinical trials. But at the start, it's really very important to inform policies, and is actually adopted. Even in fact, whenever there is a policy change, you need to ascertain the effect. If it is going to cause more harm than good, that's where the risk assessment comes in. Does it cause low risk, high risk, or very high risk as regards to that? So it is really very good at the unmasking policies that are going to alleviate a certain problem. And even whenever there is a policy change or innovation, it will still come back. They must be part and parcel of the work. Yeah, I think that was the last. I would like to thank you, the audience, for the wonderful attention that has been accorded to me, the wonderful submissions that have been made, and the informative interaction that we have had. Let us try to cultivate a culture of safety. Let's try to be proactive instead of being reactive. And risk management is part and parcel of addressing or building capacity for the next pandemics. Thank you.
Thank you very much, Mr. Michael Okea, that wonderful session, and also for leading the discussion that we had around that aspect. So we are going to have a quick brief before we go in for a break tea. As we look at risk and what we can do to mitigate GCBRs, there's a very interesting case here in, I don't know if you guys have taken a look at what we have in here. I think all of you got copies of these notebooks on the very first day. They have a lot of interesting material in here. It's not just, as you take your notes, you'll be learning at least basics that you may need to know about GCBRs. On the very first page, we have information about our initiative, what informed the thinking behind coming up with such an initiative. Then here we define first what are the global catastrophic risks. We have several of them, whereby the biological ones are only one of the components that would potentially wipe out humanity. So those examples are given here, and then we define what global catastrophic biological risks are. And then we look at some of what are the characteristics. I think some of these in Peter's presentation on the very first day was trying to tell us why we haven't yet experienced a GCBR despite having these outbreaks in the past. So he was alluding to what characteristics the scientific community has come up with to justify calling a particular outbreak a GCBR. What can be done? We are suggesting a few things here, some of which we are already working on. And now here, on the very last page of that information material, we give you examples of near GCBR events. I think for those of you who are still tuned in on the very first day, and we're looking at Africa's experience with GCBRs, Mr. Peter took us through a history of epidemiology, how these things have kept coming up and killing millions of people. So an interesting case here is the Ebola case, the Ebola outbreak in West Africa from 2014-2015, whereby the cost of that outbreak is estimated to be around $53 billion. But of that 53 billion, about $18.8 billion was from non-Ebola causes. What could those be? Let's look at the recent pandemic. Yes, we have those who died because of COVID, but those who didn't die because of COVID, but because of other factors triggered by the pandemic were also very many. the losses incurred from the impacts of that, which is why Mr. Hamilton was emphasizing public-private cooperation. And to that, I would like us to add also investing in that private sector, what we would like to call the bioeconomy, investing in that heavily so that we build our local capacity to have a private sector that can contribute to those efforts to mitigate GCBRs. So the next session, as I mentioned earlier in the morning, we are going to have, we are going to share with you commitment forms, whereby what we are asking you to do is that from the interactions you've had over this period, from Thursday, the presentation we just had from Mr. Okea about biorisk assessment, just write down only 2 things that you'd like to commit to working on in your space when you get back to either your workstation or your country. Only 2 things. So you've identified 5 focus areas from the many you've been facilitated on. The very first one is stakeholder collaboration and engagement. I think, let me ask. Yes, we are going to share with them we also have an evaluation form. So those online, we shall be sharing this with you. I think you noticed that when you're joining the link, you are being required to register. So you have all your emails, shall be sharing all these shortly with you so that you can also participate in this activity. So the first focus area on this is stakeholder collaboration and engagement. Just to make sure you are all attentive, I'm going to pick randomly. Someone tell us who facilitated this on stakeholder roles. Who remembers? Okay, let me give you a chance to be the bright one. Who remembers who facilitated us on stakeholder roles? And that was on day 1. Anyone who remembers? Dr. Robert remembers? Yes.
I think that was Lieutenant Colonel Dr. Bagash.
Thank you very much, Doctor. Yes, stakeholder roles were highlighted by Lieutenant Colonel Dr. Bagash. So that is the first focus area. The second focus area on this commitment form, so there's commitment 1, commitment 2. Just write down something simple and something manageable that you think you can easily work on. You can start with building capacity and measures in all this area. Will take an extended period of action, but things you think you can start with, let's say in about 3 months, that you can initiate activity on in stakeholder collaboration and engagement. The second focus area is the role of data surveillance and artificial intelligence in pandemic preparedness. Still, that was on day 1. Who remembers the facilitators we had under that?
Dr. Stephen Opio gave us that.
Yes, we had Dr. Stephen Opio facilitating us on that. Who else? We had the second facilitator there. Who remembers?
Dr. Jessica?
Yes, the hand online. Please, which name?
Dr. Jessica? Dr. Jessica?
Oh, yes, Jessica Bell from Nuclear Threat Initiative. Thank you very much. And we also had Dr. Christian, who is with us here, also facilitating on that. So what we are asking you to do still, the same thing, 2 commitments under that. The other session now is capacity building strategies, or simply capacity building. We had the facilitator highlight to us necessary capacity required to effectively combat GCBRs. And she mentioned a lot of things. I've already given you a hint. Who was that? who led the session on capacity building strategies?
Dr. Erin?
That was Dr. Erin Naigaga. And we had another facilitator still under the same, who now gave us approaches.
Daifuka?
Yes, Professor Diafka took us through approaches that we can utilize to build this capacity. So shall we still expect 2 commitments under that? The fourth focus area is legal framework. We've had, yesterday we had a very lengthy discussion around this topic of a legal framework and policy required to combat GCBRs. And we had a number of facilitators who highlighted the role of policy in this area, how we can capitalize on public-private cooperation, the challenges involved in all of this. A very interesting discussion. And we also had a biosafety and biosecurity session on that. So still I'll ask, just mention any of the facilitators we had in that section of legal framework and policy. Anyone who would like to attempt? Do we have a hand online? Yes, Esther?
Mr. Michael. I don't know.
Which name? Was that Fernand? Can you please come again?
I was saying Michael. Mr. Michael? I don't know.
Michael.
Yeah. Anyway.
No. I don't have a Michael here. Yes, Esther.
So Dr. David Musunga.
Yes, we had Dr. David Musunga share about challenges. Who else remembers anyone from that session of legal framework and policy? People, were we attentive? But anyway, we expect two commitments under that. And the last focus area now is risk communication and awareness campaigns. We had still an interesting discussion on that. Who remembers the facilitator of that session? I'll give that to online. Anyone online who can tell us, who took us through risk communication? You can unmute and tell us the name.
It was Chrome or what?
Who?
It was written Chrome, but there is that. No.
Actually, the facilitator shared with us Saddam's secrets. If you remember, who was that? Yes, Dr. Ernest.
Yes, Tim.
Yes, Tim Trevan. Thank you very much. So these commitment forms, you're going to share them with you right now before you block off. So you can take your time to fill them after break. We're having a very brief session after break to wind up our discussion and conclude. So you can take your time to fill up just 2 under each of those focus areas and shall collect them after that. The evaluation forms, I'll share them with you in that session after break. So for now, I would like to ask all the international participants who are here. I believe you know when you're traveling back to your countries. So kindly send your travel date and time to the CEO, Mr. Jeffrey, so that we can plan for your travel and your test, your COVID test. So kindly check your return ticket, check for the date and the time of your flight and share it on WhatsApp. I think in that group you're all there. Yes, you can share with Mr. Jeffrey on WhatsApp those details. All right, so for now we are going to go for our break tea and we shall reconvene here at 11 a.m. to wind up the workshop. All right, thank you very much. We can break off our break tea. Those who are online, you can do the same. We shall reconvene at 11 a.m. Thank you very much. All right, so as I was explaining earlier for this, okay, so I'm going to repeat the expectation on the commitment form. The understanding is that we've had several sessions since day one on various focus areas that are crucial in addressing ECBRs. So from each of those discussions we've had, we are asking you to pick 2 things only that you feel you can work on, you can start on when you get back to your workstation or country. So you write them down that commitment form. You leave it with us, and then we shall be following up on your commitments in about 3 or 4 months from now. You get the point? So those who don't have the evaluation forms, you're getting you more copies, we shall be giving them to you. So we shall collect those at the end of the workshop. So we have sections there. We have one on this capacity building, risk communication and awareness, role of data, stakeholder engagement and collaboration, and the legal framework and policy. So those are the sections. So under each of those, in your respective capacities in your countries, commit to 2 things, actionable and manageable in those 3 or 4 months. Then we shall review our progress thereafter. Yeah. All right. So for this session, we are going to quickly highlight. I'm going to ask each one of us, microphone is going to go around, to use 1 minute to just mention one take-home message from what we've discussed here. I want to make sure that as we close, I've heard each and everyone's voice. So each one of us, I'll start with those in person, then I'll come to those online. Each one of us, just one take-home message from this discussion. After that, I'll share with you the workshop evaluation document, and thereafter we have closing remarks. Okay? So I'll start with Mr. Hamilton joined us on the second day, but still I believe from yesterday's session, he has a take-home message to the Caribbean community. Yes.
Well, and the other communities that I represent, because as I said, I've moved on from the Caribbean community. I now have East and Southern Africa and also parts of Asia in my purview. But the message, I think, is that we ought to fully understand that only through partnerships can catastrophic biological risks be, 1, focused, and 2, be effectively dealt with. Countries that face particular challenges with respect to managing these risks and, of course, doing the types of assessments and having the kinds of investments that our last speaker, Michael, pointed to, tend to be low-resource countries. And just generally speaking, we literally are talking about 70% of the global space in this regard. And so without those kinds of partnerships and without the intervention of entities like SynBio Africa that looks at this specific node and puts a spotlight on it, it is unlikely that many of our states, many of these countries will actually have the kind of one, success in terms of focusing this specific issue, and 2, engendering the kind of support, certainly in the public health domain and in the policy domain, that is going to be essential to certainly manage and mitigate these risks. So the basic watchword is, or watch phrase is, all hands on deck. Everybody marshaling resources in partnership together to certainly focus and mount a largely integrated and ultimately successful strategy in terms of dealing with these risks.
Thank you very much. Yes, Mr. Peter. Mr. Hamilton has emphasized partnerships to come up with integrated strategies. Yes, Mr. Peter, what's your take-home message from the discussions you've witnessed?
My key take-home was from Dr. Bagash's presentation about the stakeholders. Folks here mentioned something about communities. So for me, as I like to think of myself as an academic, now what is tickling my brain is what would a community-centered approach to mitigating GCBR-related risks look like? I don't know what it would look like at this stage, but for me, that's something that I'm leaving this place with on my mind. Thank you.
Thank you very much. What will that community-centered approach to addressing GCBRs look like? Yes, Dr. Kamau, what's the take-home message?
Yeah, a couple of things. One, I would think from the discussion of the workshop, I think I'll need maybe to see how best then we can really draw the map of the stakeholders, given that sometimes we kind of overlook some of them, and it happens that they are very key when it comes to implementation of the program or whatever we are trying to do. So I think it would be very key for us to basically rethink the method, and why maybe some of the challenges we are facing is because of how we took it in the initial step. But also, given that I'm one of the member of our IRB committee back home, I think from the discussion that we had, we never thought, or we never kind of thought about what Hamilton presented on the dual kind of usage, and where we don't think maybe when we review the proposal or the research that comes to us, sometimes we overlook. And I would want to kind of integrate with the last presenter today on biorisk. How do we integrate that when we're doing the review? Because mostly we are doing the science and to some extent the ethics, but we overlook the biorisk that comes with that one, and especially with the dual usage, especially even when the data that you provide there is very, very key. So there are a couple of things, just to mention a few, but I know there are a couple of things that I've picked up. Yep.
Yes, thank you very much, Dr. Kamau. So the key take-home message there is how do we prioritize biorisk assessment and management as we look at these approaches? Yes, Mr. Mably, the gentleman with two pronunciations of the name, very interesting. Yes.
Thank you. It's Emebo from Burundi. What I've earned in this workshop, I can say it was very important to be here. So the first thing is to inform the Burundian people what is Sustainable Africa, their values, goals, mission, and vision. So in terms of how to prepare the pandemic, it would be important to let the country or the citizens to be aware how to prevent, how to identify the new viruses, even how the government can respond in order to ensure that those people in the health sectors are always able to fight against the new outbreak.
Yes, thank you very much for emphasizing the point of community engagement. Yes, Dr. Robert, key take-home message.
Okay, thank you so much. Me, I'm looking at a situation where we shall have a GCBR that we may not be able to control in time to save life. So in this case, what am I suggesting? I suggest we develop strategies on how to preempt some of these GCBRs. And although we shall have those which are engineered, but we shall have those which are natural, you see. So in that case, how do we preempt? So in this case, I want to emphasize the need for communication across. Because if there was a problem in wildlife, and that's where actually over 75% of these emerging infectious diseases come from. So why don't we talk to people in wildlife? You know, why don't we work with them? Because from wildlife, we shall have the amplifiers. Those are the domestic animals. The virus can move to the amplifiers, and you know, we stay with our animals. Some stay with the animals in the house. You see, in the house, the chickens and the house. So the chances of this virus jumping from the wildlife population to the human population is very high. But to preempt all these and, you know, avert all these challenges that may come, we need to preempt, and in that case, we need to have proper communication. And I want to emphasize the need for One Health in dealing with the GCBRs. Thank you so much.
Yes, thank you very much, Dr. Roberts. Communication and One Health approach. Yes, Dr. Stephen.
Well, thank you very much for everyone. We have two sections that I think was a take-home message for me. One was about private sectors. When I came here, I was not even thinking about private sector, but when the speaker said we should at least include private sectors in whatever we do, I think that was an eye-opener for me. So we have to work with private sectors because they're the ones who are going to make these vaccines, they're the ones who are going to make these drugs. And the second one was about capacity building by the professor from Tufts University. The take-home message for that is that you don't have to start from, you don't have to reinvent the wheel. Just work with, sometimes people already have a program going on, and then just the ones that is missing, you can work with them and incorporate in what's already going on. Thank you.
Thank you very much, Dr. Stephen. Private sector, as highlighted by Mr. Hamilton yesterday, and not having to reinvent the wheel when you're building capacity from Professor Diafka's session. Yes, Esther, what's your take-home message?
Okay, thank you. My take-home message is catastrophic risk are not only those that happen within the lab, but rather in the whole community as well. So as public health experts, our countries expect us to advocate on ensure proper communication to these risks are being channeled among us as public health experts, but as well community to ensure we are safe and protected. Thank you.
Yes, thank you very much, Esther. Winnie, you have been part of us since day one. What's your take-home message? Winnie.
Okay.
Yes, Judge.
Maybe she's still thinking about it. My take-home, I'm getting it from Dr. Christian. I noted that a biological risk anywhere is a risk everywhere. Therefore, it's a collective responsibility to all of us to address the challenge at hand. Thank you.
Yes, collective responsibility in dealing with GCBRs. Yes, Madam Chairperson, that's your take-home message.
Thank you so much. I reflect back on the experiences that were shared yesterday. I think one very particular one was the journey that Dr. Msunga took us through when it came to the establishment of the bill for Uganda. And you could see that it's not so different from what is happening in other places. And what does that speak to us is there is really a lot to be done. we are thankful for the efforts that are already being put in place by a number of stakeholders. For example, I am aware Africa CDC has been championing the establishment of the legal framework for Africa in relation to biosafety, biosecurity. And I think we need to, add a brick to whatever is there, contribute as the different stakeholders to see that we have these policies, regulations in place. The other one was, I appreciated the discussion by Professor Diafuka on the issue of capacity building. Took a lot of notes on the different projects that he took us through. And I think there is a lot that we can learn from there and build on, create synergies with already existing projects for us to be able to address any challenges that we may face, like on the continent. Thank you.
Yes, thank you very much, Sandra. Her take-home message was from the Lego framework and the capacity building and what needs to be done there. Yes, Dr. John.
Thank you. From the whole forum, with all respected presenters and the participation that gave us confidence that to come as a forum, as a region, has a meaning because no individual person or organization that had the answer, to the regional risk to GCBRI. So now the take-home message is we need to go for the next step, the way Sinview Africa has done it, that at least they call for over us, they don't have the answer, and they found the answer within from the participants and the presenters. And I think each one of us need to take it home. Use, if it's not at this forum, you can use individual visit to any stakeholders you think is related to things related to GCVR. And in that aspect, I believed we are synergized. So it was synthetics biology. I feel synergized to take it home with my momentum, but I will take it further and still have the colleagues in this room for answers that I don't have. So it takes us much of consortium network and consortium's action to achieve at least a vision that support a nation and the border at large. Thank you very much. Honor being in this forum.
Thank you very much, John. He appreciates the collaboration and wishes to have that continue as we work on our actions going forward. Yes, Michael, you joined us today, but I think you were part of the online community yesterday. So what's your take-home message?
Yes, my take-home message is that we need to improve on the adoption of different strategies that come up by the community. And we do this by looking at the different fear factors that were highlighted by Evan yesterday. But above all, it is a synergistic approach. We need to have all groups presented because catastrophes affect groups differently, especially looking at the minority groups. And even then, we need to have a resourceful bank for lessons that have been learned from various catastrophes, because they can act as a fundamental unit that can bring about policy frameworks for the future. In addition to that, research is still key. Looking at virus management can prevent catastrophe.
Yes, thank you, Michael. We need to communicate in a way that addresses the community's fear factors and the other strategies that we can utilize. Yes, Sandra, what's your take-home message?
My take-home message is we need to collaborate together. For example, I've realized that there are very many sectors, SBA, Ministry of Health, in our brothers in the vet department, then Makerere. There are very many sectors working on biosafety, biosecurity, and we may not be able to know who is working on what. So we need to work together since we have one goal. There is an existence of the One Health concept. However, I don't know, there are so many gaps still. It is on paper, we have the One Health concept. However, we still to collaborate together to bring up the One Health concepts to come up and for us to be able to move by safety, by security to ensure we have a safe working environment. Then also, one of the presenters talked about political involvement. For example, he requested when he was concluding his presentation, I think that was Dr. Godwin, he talked about taking the same presentations to the Parliamentary Health Committee, for example. I think this is also one thing we should take up and ensure that there is political will. We've talked about the policies and all that, but we need political will for them to be. And of course, with political will, normally there are so many priorities, but when you pack your message very well and present it to them, they are somehow touched and feel, okay, we need to do something here. Because you have to bring out the concept that if something is not done, what is likely to happen for them to be able to take up. Yeah, thank you.
Yes, thank you very much. She emphasizes that we need to have the One Health theory put in practice in the real sense, and also to be proactive about our political engagement. Yes, Ms. Soha, what's your take-home message?
Firstly, I would like to thank Sanofi Africa for this great opportunity, which brings me here sitting with all these great people, with great friends. So firstly, I would really, really thank for that. My take-home message is I would think that the GCBRS is not of that great deal, but when I can hear and see all these areas that being focused in, I understand that if you have a disaster, you have to enroll all the part of the community in order to hold this disaster. So the first thing that I have to do it is put the things in action. As I'm a lecturer, I will going to orient all my students, and also I'm a junior researcher. I will be an establishment point to understand what is the role of biosafety and biosecurity stakeholders, the legal frameworks, and the type of data and AI, and all these areas that will be focused in this workshop to orient the people. What is the actual meaning of GCBRI? So thanks.
Yes, thank you very much. She advocates for inclusiveness, and I think she has highlighted one of her commitments to engage her students on the subject. Yes, Mr. Mohammed, what's your take-home message?
Yeah, I want first to thank Bio Africa for hosting us. The take-home message is the whole information we got. I think we will try to apply back home. My research focus is AMR, and from Dr. Stephen, I got AI could be a solution for a lot of problems in the health sector. So that was one of take-home messages. Also, with good scientists who attended the workshop, we exchanged the contacts, and some of them we have been talking about collaborations in the near future. So that was also a good opportunity to have all these scientists in this forum. Yeah, because it does not happen to get this opportunity always. So I think we have solutions for the problems that the continent is facing, and especially in this East Africa region. Yeah, the focus was synthetic biology and biosecurity, biosafety, but we have a lot of challenges, a lot of problems. So we had a good information, and I think we will try to apply back home. Even the countries are not in the same level, so we have benefited the way they go through to have some of the activities, the challenges they have faced. So I think we have benefited a lot from all that areas. Yeah, thank you.
Yes, thank you very much, Mohammed. He appreciates the collaboration. And being a forensic scientist, he has also seen an opportunity to do something about data in his country. Yes, Professor Diafka.
Yeah, I think it was a very good opportunity to connect and learn more about this initiative. For me, the take-home message will be this idea of private-public partnership. And I think that could be really a niche for this initiative, or this program. Because when I look at all the initiatives we have today globally, in terms of combating, mitigating the risk of infectious, the biological risks, most of them are government related, and very few are connecting with the communities. And the area with the public sector, the private sector is basically not being engaged sufficiently. So I think this could be a niche where we can focus the private-public partnership. So that's kind of my main take-home idea.
Yes, Professor Diafka's main take-home message is from Mr. Hamilton's call for strong public-private cooperation. Yes, Dr. Christian, what's your take-home message?
Yes, thank you very much. And I would first like to thank Sembio Africa team and for the initiative, and all of us here for the quality of exchange and experience that we have shared here. That is something very important, and I think we need to build on that. So as Professor Jafuka just mentioned, one of the major take-home message is also again that aspect of engaging the private sector, who sometimes have been left aside, but we need them on board, and engaging also the communities in the plans and development of whatever we may be proposing a response to the risk. Then from there is also coming the possibility of continuously engaging this team, each and everyone on their respective capacity institution, to see what is going on, how can we continue mapping the capacities and infrastructures that we have in different settings in East Africa, for example, to make sure that when we are coming with a proposition for this program, we have something really comprehensive, and we should be taking into consideration the difference of capacities that we have in the different countries. Yeah, so this is something that we need to keep digging on. Thank you.
Thank you very much, Dr. Christian. He makes a case for the private sector, urges us to work on regional capacity building strategies. Yes, thank you very much. Yes, Dr. Jean-Paul.
Okay, thank you very much. It was a good opportunity for me to come here, but I continue in French. Donc ça a été un véritable.
Excusez-moi.
D'accord.
You can translate.
Oui, c'est un atelier qui est bienvenu, parce que ça a permis de nous réunir ici avec les différentes composantes, différentes compétences.
Yeah. So it is a most welcome workshop which allows us to gather here with our respective competencies.
Ouais, les risques biologiques constituent un volet très, très important. Moi, je suis vétérinaire de formation et dans mon pays, je fais partie du comité qui travaille notamment sur le One Health, une seule santé.
So biorisk is a very critical component, and in his country, he's member of the committee working on One Health.
Voilà, donc le dernier événement sanitaire, notamment la COVID-19, qui a secoué le monde entier, a permis de faire réveiller les consciences.
So the last event which just happened, which is still going on anyway, the COVID, was a global event which allowed people to really wake up and revive their mind and thinking.
Voilà, donc ce qui fait que nous devons prendre au sérieux les risques, les différents risques sanitaires, notamment les risques biologiques, encourent l'humanité.
So that's why it is very important now to take into consideration all those biological risks which are threatening humanity.
Voilà, mais cependant, nos gouvernants ou nos responsables politiques ne mettent pas assez de moyens pour être en phase avec l'évolution, avec les risques potentiels qui peuvent survenir, notamment dans le fait qu'il n'y a pas assez de moyens pour le renforcement des capacités, il n'y a pas assez d'argent, il n'y a pas assez de budget pour les infrastructures de contrôle, notamment des laboratoires, de toutes les structures qui peuvent engendrer des risques sanitaires.
Unfortunately, our authorities and policymakers are not investing a lot of funds necessary to build the capacities or human and infrastructural capacities to make sure that we can efficiently tackle the risks coming.
Voilà, donc je crois que cet atelier est un plus pour que nous véhiculons au niveau de nos pays. Nous faisons le plaidoyer dans nos pays pour que les hommes politiques ou nos gouvernants puissent s'engager à mettre en place ou à mettre les moyens pour que les engagements pris ici soient à peu près, disons, relayés chez eux.
So this workshop is then an added value for each of us to continue building on the advocacy at the different level in our respective countries, so that the resolution that we'll be taking from here could really have effective impact on the ground.
Thank you very much.
Thank you very much, Dr. Jean-Paul and Dr. Christian. Before you continue, I just want to know, were you able to understand all the presentations, Dr. Jean-Paul? Great. Shall I have a quick take-home message from Geoffrey? Shall get back to him for the closing remarks. Alex. We have two Alexes here.
Yeah, thank you so much. It was really a great discussion. My take-home messages, one is about stakeholder collaboration. They have continued to emphasize this, and everyone who goes back home should continue to do this, because we need the One Health approach, especially in this kind of situation where we are having a lot of GCBRIs. So that was one on the One Health approach. Then the other one is capacity building and preparedness. As you saw in the papers on news yesterday and the other day about the outbreak of the monkeypox virus. And I was reading the paper and they were saying that they had to take these samples taken from the patients yesterday to South Africa for testing to confirm if this monkeypox or not. So this shows that we are not yet prepared to handle some of these situations as a country and as a region. So the capacity building is still needed and is still necessary, and we need to continue preparing for more catastrophes, especially in biological threats as they are concerned. Then the last one was from Tim about risk communication. He brought out very good scenarios, asking us questions. What did your family ask you? The first thing. What did you think about this pandemic when it came? So as scientists, we know the science, but we also need to communicate this science well to the public. How can we be able to communicate this science? It's really, really important because a lot of expectations are out there, but how can you be able to use the knowledge that you have as a scientist to meet these expectations? So thank you so much, everyone, for your contributions.
Yes, thank you very much, Alex. One Health approach and proper risk communication. Yes, the second, Alex.
Okay, thank you very much, Tim. And I also want to thank members online and those we are with here. My take home is a question in a puzzle for the GCBRS. I'll want to categorically put it clear, and as our members have also mentioned, you know, when you don't have policies, someone yesterday or the other day mentioned something to do with shoddy policies. You find that the biorisk policy, and when we also talked about the GMOs. So going forward, I'm like, how, when I leave and I go back home, how do we going to make policymakers buy into this? Which language are we going to use to convince policymakers? Because everything, if the policymakers have not bought it, it may take long to kickstart, okay? This is a very good theme across entire Africa. But when you look at the countries in Africa, how many countries really, because I remember there's a question you even asked, how many countries here in Africa have policies on these themes? So you find that there's something short or sketchy kind of work where we're moving. So my puzzle, I want to see moving back home, what is going to be that one thing that I'll, put into the policymakers to buy into this? Thank you very much.
Yes, thank you very much, Alex. His take-home message is about how we can be more proactive in our engagements with stakeholders, in our messaging, so that we have better policy framework for that. Yes, Dr. David, what's your take-home message?
Thank you. Mine is on stakeholder collaboration in creating awareness on the GCBRs, and also from the presentation on risk communication. To borrow a leaf, the presentation was talking about risk communication in a setting of the occurrence of the disease. Can we borrow a similar scenario to communicate anticipated risk, anticipated occurrence of a disease when it is not there? And we talk about it so that we create that awareness, and therefore they need to put in place safeguards, e.g. policies and legal framework, to be able to manage these if and when they occur. Thank you.
Yes, thank you very much. Collaboration and being proactive in our risk communication, address the risks even before they actually come to manifest. Yes, Dr. Joseph, what's your take-home message? You are here the very first day, the whole day. Yes, what's the take-home message from this?
Yeah, thank you so much, Ian. Yes, a lot has been said, and I am very much amused with the responses from the various stakeholders here already. And I want to begin by thanking SBA for this wonderful opportunity to bring together these brains that are able to discuss these very important aspects of global challenges. I get my take-home message from the goals that you set for this workshop. And I'm like, if we are to create awareness and then also share the knowledge on global catastrophes or for biological risks, what's my role as a national coordinator biosafety, biosecurity? Do I have the information so that I can create the awareness? And I will say this, everybody has talked about, okay, almost 75% talking about stakeholder engagement, stakeholder involvement, and I think that's the way forward. However, you need to identify the key stakeholders so that we are able to achieve this set goal. The CEO is not on his desk, but I want him to get this message that as Minister of Health, yes, he has come back. As Minister of Health, we are very glad to be part of this very important engagement. I know you outsourced for my involvement, and I want to thank you. Please continue with this kind of approach so that we can be able to have involvement of the different stakeholders. I promise to identify for you more stakeholders who are this field and they're not here, and they would be very good resources for us to also build our national capacity in regards to the subject matter today. The second take-home message is still from the goal, where you talked about advocacy for legal framework adoption and implementation. And the question is, do we have anywhere in the world where we can benchmark a legal framework on global catastrophe for biological risks, so that we can be able to get to know our start off, or we are going to do it for the entire continent, and then the world after Africa benchmarks from us? Because I've been trying to think how best we can contribute to the legal framework. I won't repeat what I mentioned on Monday, because the contributions I'm making the other side are for biosafety, biosecurity legal framework. But from this, I am looking at, again, having another legal framework, if I'm correct, on global catastrophes regarding biological risks. My third message is from Dr. Stephen, where he talked about data surveillance and artificial intelligence. I think as Africa, we need to ride on the existing strength. He talked about having built capacity of some students and even some PhD students who are now able to analyze their own data. I pose a question to this room. How many of us understand our data, have good skills in surveillance, and they have an ecological niche on artificial intelligence? This is a very robust area which we need to interest the young people, because some of us are aging, but we need, since one of the is it a mission where it talks about students, building capacity of students and the other stakeholders, I want to see more students interested in this. So if we can move synthetic biology Africa from where it is to another level, because we need to have systems in place. So can we have, how can we interest, I think is the question, how can we interest the young scientists in this particular very important area? Because everybody is doing molecular biotechnology, epidemiology and biostatistics, but when you come to this, they say, I did it for my master's degree and I stopped there. The practice is where we have a challenge. So can Dr. Stephen and team have an opportunity to build the capacity of the other students so that we can have a pool of African scientists being able to safeguard our information. And I conclude by saying we still have a challenge of information security. If I'm to understand very well, we had a lot of discussions with Dr. Stephen, and he continued saying our data, what they keep is not theirs, is for somebody. How that somebody gets it and takes it where they're supposed to take it. I have a challenge. I've visited, I think I was in the New Mexico, and somebody was presenting data regarding Uganda. And one of the questions I posed is, did you get permission from my country to present this beautiful information here? And the snag was hit. So how do we safeguard against that? We have a lot of technologies, rather we call them innovations, and the new technologies being used in science as we produce solutions, but then we are not in control of our information. I thank you.
Thank you very much, Dr. Nkodio. Stakeholder collaboration, data, as Dr. Stephen mentioned, we have an ongoing effort within Single Africa to build capacity in that area. And regarding where we can benchmark, I've just checked and Dr. Susan Kropp is still with us online. Maybe you could give us an example when you come to her, because we are coming to the online participants after this. So Dr. Susan, when you get to you, shall quickly ask whether there is anywhere we can benchmark a policy on GCBRs, so that we can develop one for African countries. Thank you. Yes, Dr. Ernest, what's your take-home message?
Yes, I want to tell thanks at the team of this workshop. I got many experience in this workshop, but for the rest, I want to tell there are many topics: building capacity, risk assessment, and intelligent technology. It's new things. But when I will come back, I put together private society and public society to do something. We need the help of the SBA Africa to write our goals. Thank you.
Yes.
I try to speak English, but my English is not clear.
Merci beaucoup. Thank you very much.
You did so well.
But I think we've picked it. Yes, money back. What's our take-home message?
Yeah. Thank you so much for the opportunity. First of all, I want to thank SBA for the well-organized training workshop. I think it has been great, and I give you credit. But again, when you check on the global trends, you'll see emerging and emerging diseases. AMR, biosafety, biosecurity is a key interest, not only for Africa, but the whole world. So I think SBA is doing great, and you're in the right direction, and we promise to support you accordingly. But from the programmatic point of view, I have seen that countries, all of us actually, and from different presenters, there has been an issue of allocating monies to BS or SBA-GCBRI, which is cutting across. So I think my take-home message is that we need to advocate for more resources to this core, and it begins with us because countries have been selected, and I think they expect the report. So it could be one of it, and as you go back to our respective places, let's make sure we start this. And to me, with Nkodio, we've already started engagements and how to get more resources for this. And I've also started with the CEO of SBA. Hope you shall support us accordingly because it has been really, really hard. Even when you go through projects in the country, you see they are putting monies in quality management systems, mainly quality management system HIV, but biosafety, biosecurity has been an issue. So it is something that we did not take slightly, and COVID has presented an opportunity for us to ride on. So let's use it when it is still fresh, and we shall go very far. Being almost the last presenter, perhaps much has been said, and I give the mic over to my neighbor. Thank you once more.
Yes, thank you very much, Mr. Gordon. Yes, Daniel.
Well, thank you so much. Great credit goes to the organizers, the CEO and his team. It has actually been a great opportunity for me to be in this forum, something I appreciate so much. Back to the workshop. On pandemic preparedness, we saw quite a number of key stakeholders that are involved. And these key stakeholders have their different roles to play. We saw the public and medical, we saw the security, we saw humanitarian, we saw the policymakers. So all these people play vital roles in execution and fight of in the fight of the pandemic when it comes. Previously, we used to wonder why a lot of money is being allocated to security, only to realize they are key stakeholders, they are stakeholders. That's why they are being given the money alongside Ministry of Health. So some of this light has been brought up, and it's something we appreciate. On the capacity required for pandemic preparedness, one of the doctors intimated that universities need to channel out field-ready graduates. And the graduates that are coming out needs to be equipped with all the relevant knowledge that are required to fight the pandemic at whatever instant it comes. And this is an input that is played by the academia, academia. We saw that they are doing this through curriculum review. We saw that, in fact, in some secondary schools, they're already rolling out a curriculum that stresses competence-based. So the people coming out really come out when they are competent to handle whatever comes up. Thank you so much. Appreciate it.
Yes, thank you very much, Daniel. That was our last in-person participant. So for those who are online, I'll call on your name and you unmute. And within a minute, share what your take-home message is. So I'll follow what I saw on my screen. So I'll start with David Kiyoko. Can you please unmute and share with us what your take-home message is?
Thank you, Ian, for giving me this opportunity. First, I thank the SBA for organizing this great event. I've learned quite a lot, and I've been in research for close to 40 years. And every time I attend a symposium like this, I learn a new thing. Right now, what I've learned and what I'll take home to my country, Kenya, is communication. And here we are talking about communication about risk. I benefited a lot from Mike, who gave us risk communication, risk mitigation. One sentence I took, which I took very seriously, is if you do risk and you end there, it becomes useless. We do risk so that we can mitigate. So he talks about cover, correct, and prevent. And that is the whole idea of all this meeting. And somebody, Dr. Jagero, talked about benchmarking. We know we are from different countries. We are not at the same level. So I would urge all of us to benchmark so that at least we bring the laggards with the innovators, we come together and really have a robust issue. The other thing I learned is the same thing which has been repeated. When we talk about stakeholders, to me, the private sector was not in the picture, but right now it has been emphasized. They are in there because they are the people who are producing all these things and they need to be on board. And with that, I thank you and I hand over.
Yes, thank you very much, David. Next person on my screen here is Geoffrey Jagero. Can you please unmute and share with us what your take-home message is?
Yeah, thank you so much. I want to take this opportunity to thank the organizers, SBA, for putting this meeting together. There's been a lot to learn. I just want to share with you a few of my thoughts taking away from this meeting. A lot has been said, but I'll just try to emphasize on some of them anyway. One of the questions I was asked at the tail end of the meeting was, why was Africa not able to produce COVID vaccine against COVID-19? And by and large, we know that the reason that was fronted at the time was that Africa wasn't ready with regards to the legal, regulatory, and policy framework. So that's an area I want to believe we can really look into and strengthen moving forward. Area that would address so many things, including, matters to do with the material transfer agreements that has just been alluded to. Why would someone be presenting Uganda data in Mexico? Did they get the permission to do so? Would we be able to put infrastructure ready to manufacture our own vaccines against future potential threats when they flare out? So those are issues that really can be addressed through the strengthening of our legal, regulatory, and policy framework that would address at state level and also at institutional level. Two, is that we need to strengthen our capacity on early warning system through surveillance, diagnosis, and also pathogen discovery. But we need to do this under One Health. It would be good to do surveillance. It will be better to discover some of these pathogens and know how to handle them even before they become, they come unto us in the form of a disease outbreaks or pandemics into the future. One thing is for sure, and I'm not, I'm not a prophet, but I could say with a mathematical certainty that in future, these threats will come to us whether we like it or not. The question is, will we be ready? Three is we need to enhance the culture of responsibility and accountability among bioscience practitioners. And this is key for those who are averse with biosecurity issues. Two concepts. One, the insider-outsider threat. Usually a lot easier to address the outsider threat, but it's more difficult to address the insider threat. You and I, as the scientists, who know and understand the technicalities around biological materials that we're using or manipulating, the technologies that we're using to manipulate those biological materials, including the sophisticated equipment, the concept of dual use, and using science for the benefit of humanity. Enhancing that culture of responsibility and accountability among ourselves is key. And lastly is the need to enhance awareness among our youth. They are the scientists of tomorrow. I'm glad that I had a colleague mention that there are already programs in place. I don't know whether this is in Uganda, where at college level, people are undergoing training, maybe pre-service in biosafety and biosecurity. I think that's important so that we get to pass down that awareness at the very early stages on responsible conduct within the scientific space. Thank you, and back to you.
Yes, thank you very much, Mr. Geoffrey Jagara. On my screen here, the next person is Newton Fernand. Can you please unmute
Yes,
and share with us
yes.
briefly?
Greeting to everyone over there, to the expert and also to SBA. Thanks for giving me this opportunity. I think I've been really learning from you and from this network. I really appreciate your consideration. I would like to summarize all those take-home messages into this acronym: 2CD, 2C, 2C, D, 2C. It's not like CDC, but there is a digit 2 there. That digit means we need data. So it means the first 2C means collaboration and contextualization. Let's collaborate with others and get all those framework guidelines. And then when we get them, whether it is international legal framework, when we get them, let's now contextualize it. Let's make it, let's put it in the context of Uganda, Kenyan context, and then develop our own legal framework. And as we have that legal framework, we need to digitalize it. That's where the D comes in. Let's use data-driven tools to digitalize it so that we digitalize for better assessment and accountability. We don't keep going back and forward. So we know that we are moving somewhere, and we can question when someone asks us question, is this really good things to do, or they said this thing is not good. You can tell that person that in the past, but you told us that this whatever we are doing can move forward, so it was good. Why are you now saying that it's not a good action that we are taking? So let's make it use data-driven tools to make it digital. So the two last C means communication and capacity. Communication, how can we communicate whatever we have been learning as a scientist? I have one of my prof in philosophy usually tell me, you have all those knowledge, but you will go back to your home country, Benin, and what are you going to tell to your grandmother over there? Are you going to tell her about science? No, she will not even listen to you. So you need to adopt another language in order to communicate a biorisk. It should be biorisk assessment, whatever we have gotten from biorisk assessment. So the last two, which is capacity building, and I would like to appreciate the effort of Dr. Stephen on building the capacity of PhD student on data analysis. And I would like to tell you that I have been also trained on how to analyze bacteriophage, annotate, assemble, and annotate bacteriophage data using command lines. And one of the questions that the trainer asked me, the trainer were from United Kingdom, they were telling me, how are you going to utilize that knowledge? I was telling them that I will use it to keep building the capacity of any African phage researcher who would like to annotate their bacteriophage genome. So that's what I've learned from this symposium. 2C, D to C. Thanks so much for your consideration.
Thank you very much, Newton Fernand. The next person on my screen, Dr. Susan Kropp. He facilitated us yesterday on the U.S. Federal Select Agent Program. What could be the take-home message from the discussions you've witnessed by the past 2 days?
Yes, good morning, everyone. I think that I would have to say that I very much agree with Dr. Robert. I think that the best thing that can be done is to look for ways to prevent a GCBR, because actually responding to one once it has happened is going to be a much greater challenge. And I think that what you are doing right now is key to this. I think that communication and collaboration are the way forward to preventing something like this from happening. And so I would like to say that sincerely, Symbio Africa has the right idea in putting together this amazing workshop. Look at all the amazing people that they have brought together, because not a single person knows every different aspect of the problem that needs to be addressed. That's why everyone has to collaborate and communicate. And I guess that I personally would also have to say that I truly appreciate the talk yesterday by Dr. Irene on capacity building, because that is especially forward-leaning and forward-looking, I think. So thank you all for allowing me to participate in this, and I can't wait to see what you do next. Thank you.
Thank you very much, Dr. Susan. There's a question I had saved for you on whether there is any GCBR policy in the US. Is there any? Or
I'm sorry,
biosecurity at the very least? Is there a policy or law on GCBRs in the US, or a biosecurity law or policy?
So in the US, we have a lot of different policies. In terms of addressing a GCBR, we're in the same, look at the COVID situation. The US is in the same spot as everyone else, we're just as affected as everyone else. And were we able to prevent anything any better than any other country? I don't know. I think that benchmarking policy is up to you. I think what you want to accomplish. And I think that when you set goals and achieve them, that is your own benchmark. That is what, when you accomplish what is most important to you and to your country and what will benefit you the most, that's the ultimate goal.
Yes, thank you very much, Dr. Suzanne. The next person on my screen here is David Muteti. 1 minute, please. What's your take-home message?
Sorry, David Muteti, David Kyoko is the same person. I have already done it.
All right. Then Eric Tokerunga, take-home message.
Well, thank you very much, the organizers of this training. Yeah, I think it has been a very enlightening training as far as biosecurity is concerned in Uganda. Yeah, I'm a medical laboratory scientist, and at the same time, I'm a postgraduate researcher pursuing my master's degree in molecular biology at Wuhan University here in China. Yeah, so I'm actually at the place where the origin of COVID-19 started, you know. And I can tell you from my experiences that in December 2019, that wasn't an experience that any one of us would want to live in. You know, it was as scary as you can imagine, that 2 years afterwards, people still shiver when they hear about COVID-19. Yeah, so this kind of fora, I know, will go a long way in making sure that us as scientists, we are able to carry out our work in a very secure manner, first of all, for us who are working in the lab, but again, for the wider community on whose behalf we are trying to create all these synthetic biology benefits that we can make in the lab. My biggest take-home message from this is that I really appreciate the interconnection between the private sector and the government as far as biosecurity is concerned. You know, us in the private sector, we can only implement what the government has put in place. And like the speaker was saying yesterday, you know, the private sector will never initiate anything, but they can only enforce what has been put in place by the government. Yeah, so and I must say that the private sector is always ready to, you know, implement these things as long as it does not hit their bottom line, which is to make profits. Yeah, I would like to encourage SynBio Africa to continue with these kind of wonderful programs. I don't know where the funding comes from, but I would be much interested if majority of the funding were to come from the individual governments, you know, of where these programs are being implemented, because then that you know, ensures the sustainability of the programs. Like Susan has been saying, you know, the best benchmark is doing what benefits you yourself, and usually the person who pays the bills will always dictate where the policies go. And that's how we end up with silo programs where we have good ideas, but we cannot take them forward because at some point in time, the funder changed their mind, or, you know, funding was cut. Yeah, so I thank you so much for organizing this program, and I'll be looking forward to any future participation in this important activity, because it touches the core of my work and to the greater benefit of East Africa and Central Africa. Thank you so much.
Yes, thank you very much, Eric. Fortunately, for the case of Uganda, the national coordinator of biosafety and biosecurity is here. So hopefully the government can sustainably invest in biosecurity measures and initiatives, some of which are seen by Africa. Yes, lastly, I see Kano Dr. Bagash online. Kano, if you're in position to speak, would like to pick your take-home message from the discussions you've witnessed. past 2 days.
Yeah, thank you. Do you hear me?
Yes, please, we do.
Yeah, okay, thank you. Good afternoon.
Good afternoon.
Sorry, I only chipped in the last minute because I wanted to close with you, but otherwise I'm up country for barriers. I told you we lost a relative, but I wanted to see the last bit of it as you are closing so that we close together.
Yes, so what you found us discussing, each one of us is
Yes.
sharing a take-home message from the sessions they were able to witness. So what's your take-home message from the discussions you witnessed?
Yeah, oh, okay, well, yes. Thank you. See, GCBR, the GCBR is a new concept, and it was almost unknown to us. However, having experienced pandemics and for the unknown, what I see post measure or approach. So it is a whole of government approach. It is One Health, as I can see, all centered to promote and enhance biosafety and biosecurity in order to prevent these catastrophes to happen. So for each member state, I will probably now comment about Uganda. I think we have laid the ground. The ground is now rich for us to now take off from there. However, we need to now implement these legal frameworks. We need to have these documents approved, the policy and the law, so that we can move forward. Other countries have so far had these things in place, so they are ahead of us. So we shall always benchmark on what they are doing in order to move forward. I support Symbio Africa for this initiative, and I hope in one of your undertakings, you said you have a high level engagement. I hope as we talk, as you'll be leading us in having these high level people. Buy in. Thank you.
Yes, thank you very much. Senator Dr. Bagash, please accept our deepest condolences for your loss. And thank you very much for joining us for this workshop.
Thank you.
So that brings us to the end of that section. I'll quickly take you through what's in these evaluation forms, and then we shall briefly have closing remarks. But before that, Dr. John Ding, you have something for us?
What I have is not new, and because I have everybody here, and I have no word to describe my gratitude and my knowledge that I've gained, I just want to write a script that I learned from a good colleague, and I learned it through same workshop. And I think one word to tell the organizers. Thank you, Sandra, the chair. Thanks, Geoffrey. Thank Hayen. But Hayen has won my intelligence. He's calling all of us by names without even reading from somewhere. So because of that, I just want to compose what my brother composed to me some time back. And I think you fall under the middle of the song. And we are trying to create lyrics to just say two for this line. And I don't know how many two, Joe, Gordon, do I have? 4 or 3? A test for you, it's okay. And then we come to say to whom to. I think there are three. Then, to whom? You know the singers, they really don't sing, they let other people sing. Just one word. And you repeat several times and make a lyrics of like 5 minutes. So, to whom does it belong to? So that we have a way, the one closing knows that we are too gratitude that the thing doesn't actually belong to him. And because you'll have the answer at the back of your mind. So this line, this one, including Geoffrey, will sing two, two, two. And you see the lyrics, you can bang on your table because we want to. I hope this were three so that I put one here, one there. If there are two, please give him one. Him, the last person there. And then this one we say two, two, two. This line. This one, to whom to whom to. Don't repeat what the other line is saying. Then this one, to whom does it belong to? To whom does it belong to? Then the answer is the one that going to tell us. Because I think this thing belongs to me as individual, and I don't want to leave you out of it, and you have to replicate it wherever you go. All the word we have had to. So I think we begin. So just say two, because the English language you have. the lyrics goes like this. They start fast. Two. Twice. So after twice. And the whole you understand?
Okay. Two.
Then let's say four. Then four. Then all of us. Let's just have it.
Okay.
Two, 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 two.
Yes, thank you very much, Dr. John, for that session. Before I come to explain what the evaluation forms have, I'll give Dr. Stephen a minute to share with us briefly.
Hello, everyone. Thank you very much for coming. This has basically went beyond my expectation. And my humble request for you is let's not stop here. What next? So I will be following up. I'm a project consultant for Seen by Africa. I'll be following up, and then I would like to start from now. So after this, I'll be following up, and then we'll go from there, okay? Thank you very much.
So you're going to have more about 3 closing remarks, but before that, let me explain what's in the evaluation form so that you can be filling them as those individuals give their closing remarks. So the evaluation forms are really quite simple. Don't worry, we shall not grade them. Every answer is correct. So you basically want to pick your mind on what you liked, what you didn't like in the workshop, and how we can improve for the subsequent workshops. So Winnie will be distributing those evaluation forms to you. Those who are online, we shall be able to send them online later after we close off here. Those online, we shall send you the forms and the commitment forms as well. Evaluation and commitment forms. Very, very easy. You just circle. Then you have space to give us more specific detail on how we can improve or what we should maintain, things like that. All right. Thank you very much. So this is how we are going to have our closing remarks very quickly. We shall have first our project coordinator, Dr. Robert Chibuka, make closing remarks, after which we shall have the chairperson of the executive committee of SynBio Africa, Ms. Sandra Martini, give her closing remarks. And finally, we shall have, before we come to Mr. Geoffrey, we shall have a volunteer from you to give a short, how do you call it? Token of thanks, word of appreciation, something like that. Then after we shall close with Mr. Geoffrey, and we officially close, he will officially close the workshop, and we break off for lunch. And those online also get to break, to call it a week and a workshop. Personally, I would like to thank you all for making it here. As the one in your emails most of the time, email inboxes. Thank you for bearing with us, the changes we've made to the agenda, to the venue, to all the things. And for going through all these also to make sure you're here with us for the entire 3 days. Some of you, it's your first time in Uganda, so probably that's a very new experience, but we thank you for being able to come here. We'd also like to thank you for being active in your participation. At least I've heard each and everyone's voice. That's how I'm able to remember your names. Because I think everyone has had a contribution to making this workshop. My only prayer is that as we go back to our stations and our countries, we really work on what we are committing to work on. Thank you once again, and we look forward to engaging you more in subsequent engagements as part of our SynBio Africa network. Thank you. At this point in time, I would like to call upon Dr. Robert Chibuka to make his closing remarks. Dr. Robert.
Good afternoon, ladies and gentlemen. I think we've been very active. Let's stand up and just clap for ourselves. Let's stand up, just clap for ourselves that we have really done. To me, according to you can sit down. According to my assessment, I think we have had a very successful workshop for the 3 days that we've been here. Thanks to the CEO and the rest of the team that I work with that has been able to put all this workshop together. Also want to say that I think we are not going to end here. There are so many things that are going to come out of this workshop. I'm looking at, I think we have already made friends, isn't it? That is very, very important. We are now going to start exchanging emails, you see, regarding biosafety, biosecurity, regarding the legal frameworks, how they are doing, in different countries, and so many other things. And probably some of us will fly there and come and see you. Imable is in Burundi. We have had some discussions. You might see me in Burundi one day to come and visit you as a friend. You see, this is what such meetings create. You see, I didn't know that I would meet Christian again. But Christian is here. This world is so small. We've met. Yes, Dr. Diafuka. So we worked together, me, Christian, and Dr. Diafuka, for maybe 10 years. So under One Eastern Plan Eastern Africa, which is now AfroHone, and we are all focal persons in our respective countries. We are leading these projects where. So I think there is a wealth of experience that we have, we accumulated over time, and which we can share. Hamilton is here. Hamilton, we expect partnerships. we expect money, resources to move this project forward. That's what I'm looking at from that angle. I don't have much to say. I just want to thank you so much for spending time to be with us. And I wish you a safe journey back home. Thank you.
Thank you very much, Dr. Robert. Dr. Robert Chivuka is our project coordinator of the Symbio Africa Global Catastrophic Biological Risks Initiative with extensive experience in that area. The next person, Chairperson Executive Committee, somehow by coincidence is also a very experienced biosafety expert. You're most welcome to give us your closing remarks.
Thank you so much, Ian. A very good afternoon to you all. I stand here on behalf of the entire team of SynBio Africa. Some of our members are not here, but they know we are here and they are very grateful that you made it to this place, including the participants who have been online for the 3 days that we've been here for the workshop. So we extend a vote of thanks to you all, our dear speakers, the interactions that we've had here, the experiences that we've shared, they have been great. The participants, thank you so much. You've been very, very active. The workshop has been one of the very active workshops that I have been to. I don't know what the experiences of others are, but that's what it's been. Of course, I really want to appreciate the team from SynBio Africa that put this together for pulling off this workshop to what it is today. It wouldn't have been possible without your relentless efforts. A vote of thanks also goes to the service providers that we've had. Thank you so much for you have been there and made this possible. And I think it will just be so unfair if I don't give a big appreciation to Open Philanthropy, who have made this workshop possible. We truly, truly appreciate the support that we've got to have this workshop be what it is. Beyond that, I would like to urge all of us who have been on this, both here and the people online, that we have shared a lot in this room. We have shared the experiences from the different countries that we are coming from. And from even the private discussions that we've had, we can see that there are a lot of ideas that could have been beaming up in your mind on what we can do to make this project achieve the goal that it's aimed at. And it will only be right that with the commitment that we are making, when we go back to wherever we are going to, we embark on these particular action items and implement them. So as Dr. Stephen said, we'll continually follow up and we look forward to bigger collaborations, the different projects that you're implementing, or any opportunities that you may know of that we can together be able to, put some concepts together and see how we can implement them and support Africa as Africans. With that, I would like to say thank you so much. Thank you so much for coming. I hope you've had a great stay in Uganda, and I hope you'll have an opportunity to, for those who have some time to move around and see a little bit more of Uganda than just here where we've been. And we look forward to meeting some other time. We are looking forward to as well meeting in the subsequent workshops that we are going to have in the other regions on the continent. Thank you so much, and I wish you a very good stay. I wish you safe journey to those who are traveling for God and my country. Thank you.
Thank you very much, Madam Chairperson, Ms. Sandra Matini. I would like to urge all of us after here to keep an active part of the Sinvio Africa network. Probably you wonder how you were able to identify who from here and there. It's through that network that you also invited to be a part of. Yeah, so Sandra has mentioned of those who have an opportunity to hang around a little longer. Our office is not very far from here. Kisubi, just after that connection of the expressway. So probably those who may have a few hours to spare, especially the international guests, may have a chance to see our permanent home, Sinvio Africa. So I'd like to ask, who would like to volunteer to speak on behalf of the participants? Yes, thank you very much.
All protocol observed. In no particular order. First of all, I want to thank the online participants. They are our better half, but all of us know it takes 10 times more effort to be active online than in person. There are so many distractions, but thanks to the folks who made it, not just today, but all the other days. I know some folks like Jessica couldn't be here all the time, but they were there. Then in a special way, also thanks to all the different sponsors, most especially Open Philanthropy, and thanks to the hotel. It hasn't been a bad experience for us, the walk-ins, but probably I think it has been even better for you who are staying over. And thanks to Sinvio Africa. Why would I say this? You know, if some of you remember 2008, 2009, there's that movie that came out of Will Smith, I Am Legend. And in the setting of that movie, the world had collapsed and he was, I think some kind of microbiologist, and he was left. His wife had died, his kid had died, the country had collapsed. But yeah, he was alone. He was trying to find, he had his dog and he was trying to find the cure. So for me as a medical student, I watched that movie and I loved that. First of all, it was a black man taking the lead. But I really asked myself, if an extinction level event happened in the world today, what would happen to Africa? What would happen to Africa? And I asked myself, so what's the starting point for Africans? I was telling him that you find many of our counterparts in other countries, they go from bachelor's to PhD in just short 10 years, and then they begin their work careers. For us, PhD is a retirement plan. You know, what are you doing? I want to finish my PhD, get 10 years somewhere, and just live out the rest of my life. So it really bothered me that how are we supposed to build our capacity to deal with extinction events? So of course I got excited when I saw, like I told him, I saw that there are actually people in Uganda getting involved with synthetic biology, and the other day I had the youngest PhDs in mathematics. So for me, it makes me realize that things like AI, machine learning, synthetic biology, they're not as far away as they used to be. And if you look at the age distribution here, it's all over the place. And that's good because we need the young people to learn from the older people, but also to take the lead and involve more people. So this workshop for me was very exciting. As a participant, I felt it was exciting to meet all these people and to hear the different presentations and the topics. I want to thank the production team just for making all this available online and professionally. It was really good. And so my closing thing is all of us just need to keep thinking. Don't think in the sense of if the world is going to collapse anywhere and I'm just one person and I can't contribute, why don't I just go and dig and wait? All of us have a personal contribution you can make to the collective effort. And you also be in that position whereby you're like, okay, I'm a member of the SynBio Africa Network. Not what can it do for me when is the next conference, but what can I contribute? Send this man your graduate students. You know, when you hear of some PhD opportunities or some skills labs, hey, write to him and say, can you look in the network? And then, when networks build value from exchange of opportunities, that's the real beauty of networks. Write to him and say, I want some 10 graduate people to come to Tufts, or to Ohio for 2 months. Now, when he sends it out, all of these other guys can send one person. But then next time, even them, someone will invite people to Burundi for a week or 2 weeks skills lab. And slowly, when people see value in the network, and all of us have something we can contribute, I assure you, we just have to dig deep. So let's not ask what can SynBio, what can Open Philanthropy, what can UNODA do for us. Let's ask what can we do for them. Yeah. So thank you as a participant. It was an exciting experience, and I think everyone here enjoyed it as well.
Yes, thank you very much, Mr. Peter, for ably representing the brilliant minds here. And finally, I would like to invite our CEO and the principal investigator of this initiative, Mr. Otim Geoffrey, to give us his closing remarks and officially close the workshop. Mr. Geoffrey.
Okay, I'm sure all of you are happy. The excitement and the encouragement that I've got from your turn up and your participation is enormous. I want to start by thanking all of you. I'm sure there are people who have been with us online since the first day. I thank you for sparing your time and putting your own resources to be with us from the beginning up to now. So in a special way, we have 3 categories of people to give a vote of thanks. As I've said, we have participants who are in person here, and then those who are online. And then we have our speakers who made through here in person, and those who managed to give their presentations online. We thank you. And then the most important part of the people to thank are my team, my SynBio Africa team, the organizing committee. They have done a great work to organize this workshop. If it was not because of them, we would not be here. So I thank them. And I want to thank our service providers, especially the IT guys. They have done wonders. I can compare with the conference that we had last year in October. I think you did a great job. So in our subsequent workshops or conferences, I think we shall give you some consideration. Yeah, so I want to apologize because, you cannot be perfect. And the organization of the workshop, I cannot say we were very perfect. We could have caused some inconveniences to some few people because, there are a lot of things involved in workshop like this. I know some people spent a lot of time or they got stuck somewhere during their travel to come to Uganda. We apologize for that. Any other inconveniences that you could have faced, we are sorry for that. This workshop, as I told you from the beginning, this is just the first workshop out of a series of workshops that we are going to have in this first phase of the project. So this has been like our pilot. We said, let us start from home. We polish this from home before we go to other regions. So we apologize for that. We are going to correct that in the subsequent workshops. So moving forward, I've attended many workshops, many conferences. I've been in fellowships, but what I've realized is that in most cases, when people leave a workshop like this, just after 2 or 3 days, they have forgotten everything. But always there are those people who will always not forget. And I'm one of them. And that's why we are here today, because of the 5 years journey that I started, and we are progressing well. So I don't want us to live here and you forget about everything that we have talked about here. We have learned a lot. So I want us to put in practice the commitments that we have, put forward. So moving forward, I was very happy, I was following, whether I'm not here, I was following all the presentations here. So we hope to continue with you in the subsequent workshops that we are going to organize. So especially our great speakers, you did great work. We appreciate that. And rest assured, we shall be reaching out to you to present in the subsequent workshops that we are going to organize. So thank you for that. And what we were giving commitment here. So part of the activities that we are going to do is to follow up. Yeah, we are going to follow up with all of you. And if it needs traveling to your country, we are going to travel to your country. We are coming because we don't want this initiative that we have started to die like that. I'll do my best to make sure it progresses. So another thing that I wanted to inform you is that especially the people we invited from outside Uganda, if you have any initiative or you want to organize any workshop, you can always inform us. We can always be available to support in any way we can support. We can always identify the best speakers, to facilitate in those workshops. And also, if we have some resources, we can support. So go back to your country and make sure you come up with an initiative that can promote this GCBRI awareness. So to keep us together, I think we have already a WhatsApp group. Let us not take it for granted. It's a very good, more accessible platform for communication. So I think if you're here and you're not in the group, please find my number, send me a WhatsApp so that I add you to that group. And then yeah, we shall always keep the discussion going on there. So I was thinking that to keep us moving, I think we can, after the workshop, and we can always discuss and see what initiative we can do together, you know. Yeah, because it's difficult to keep people on track when there is no any initiative bringing people together. So we are going to brainstorm on that and see what we can do together as Eastern Africa, because we have Eastern Africa. Eastern Africa is composed now of Central Africa, because I told you we wanted to make 5 regions, but due to limited resources, we have created 4. So Central Africa and Eastern Africa, we are together. So in any initiative that we are going to come up with, you are also inclusive. So that is what we are going to discuss in our groups, WhatsApp groups. So Mr. Kodio, so thank you, Mr. Kodio, for giving us the announcement about the commitment of Ministry of Health to work with us. We are so grateful. This initiative, Seen by Africa, has been there for the last 5 years. We have been at the background there, you know, actually working very hard. So somebody has talked about the iGEM. I was the first person to start the iGEM team, actually, for the whole of East Africa at Makerere University. That was in 2018. And through the network that I got, we were able to raise some funding to send our students to Boston in US. We didn't have enough funding, but we managed at least to send the team leader. Even me myself, who started, I didn't even I was not even on the budget for traveling to US, and I'd never traveled to US, imagine, by that time. So we sent Alex. Alex is here, and yeah, Alex is here. He did great presentations there, so people were very happy. And afterwards, he has been the African coordinator for iGEM. He's a big person now. Yeah. Yeah. And he has graduated. He's officially a doctor, Dr. Alex. Yeah, so Claudio, you asked a very tough question about, yeah, but you also said you are going to bring on board some other stakeholders. They are most welcome. We can always talk about that and see how we can, you know, broaden our operations. And then the legal framework for GCBRI. As you heard, Ian also tried to ask Dr. Susan Kropp from US. GCBRI is still a very new area, just like synthetic biology. So if you do your search, I don't think you will get any specific legal framework on that. I mentioned, I think on the first day, I said for Africa, I think the first one that we are going to work on is a political will framework. This is about engaging the policymakers so that they, you know, have a framework in place for, you know, preparedness, pandemic preparedness, because I told you these policymakers, they are the ones who allocate budget for some of these things that we are talking about security, about safety, and now GCBRI. So this is an initiative that I said Africa CDC is going to take lead, and Seen by Africa, I mentioned that Seen by Africa is one of the key partners. We are grateful for that. So we are going to engage parliamentarians at a very high level, Pan-African parliamentarian. So I think about 3 categories of parliamentarians. So that is why we have that high level engagement as our objective for this first phase of the project. So we are going to be updating you on that. It's the first legal framework on GCBRI that Africa is going to be proud to work on. Yeah, so you talked about bioinformatics and data science capacity building. Dr. Stephen is already doing that as part of SynBio Africa, giving back to the community. Yeah, so we have already trained about 42. First cohort already graduated. The second one, I think they're about to finish. So already we are doing that. And yeah, I think those are the things that they brought. Source of funding, somebody asked. Some already mentioned, we are grateful for the support from Open Philanthropy. We are here because of the support they have given us. Okay, so I think we are now coming to the closer of the workshop. Just in a few minutes, we are going to close. I want to take this time to make some few announcements. Ian was supposed to make the announcement, but I think he has talked a lot. I can also help him. For people who have come from outside Uganda, we are going to, especially those who need PCR test, we have contacted the service providers. They are going to come here just after lunch. So you can contact Jocelyn. Jocelyn is there. You can contact her and get on the list so that you take your test in advance. We don't want a scenario where you get stuck. Because me personally, I got stuck in France previously. I got stuck for two more days because of delayed PCR. I could not check in, I could not go anywhere. So I don't want that to happen to our participants. Okay, so, and then I think most of the people are traveling back out of the country tomorrow. So starting after lunch, I think you're free up to tomorrow. So if you have any plan to tour around Entebbe or Kampala or nearby places, we have Claudia who can arrange for you a tour around Entebbe or Kampala or wherever you want, or an activity you want to go for boat ride, any activity you would like to enjoy. I think Claudia is there. She can, yeah. I think she will charge you some small, dollars. Yes. So that is it. And so I'm very sure that some of the international participants, they could be having some reimbursement that they need from our side. So due to, we are still having so many things to sort out. Our finance officer is there. She can, so after the workshop, we advise you to get in touch with her, and then we see the best way how we can sort you out. We don't want anyone to, be inconvenienced. This is our first initiative that we wanted to go smoothly. So get in touch with our finance officer, Winnie. We shall work on that and sort you out. So I think what came out late and we forgot was that we have our office and we expected to take everyone to visit our office. I don't know how we forgot that. Yeah, our office is not very far from here. So I think for those who are traveling tomorrow, we can find a way of transporting you to our office so that you know you are home. Our office is your home. Anytime you are welcome to our office. So we are going to arrange for that. And lastly, I think we have almost everyone here. So from here, let us go and take group photos. Okay? We have been taking in the last 2 days, but I think others were not there. Today I see everyone is around, so I would love that we take the final group photo for remembering the day. So I think also it will apply to the online IT team will, I think, also take the group photo for the online participants. Yeah. Lastly, I'm always available. Much as I'm also very busy. So if you have anything you would like to know more about SynBio Africa, anything you would like to know about the GCBRI project, anything you would like to know about IGM, you can always contact me. I don't know how, I think all of you at least should be having my contact, whether phone or email. But I think Ian can write it somewhere so that can write it here so that you take my contact anytime. You can always contact me. And I think I've talked a lot and we have engaged a lot. I'm so happy for the active participation that you have exhibited. I appreciate that so much. As we pack our bags, let us not forget about these 3 days that we have been together. Let us always keep together, and the commitments that we have made in writings, we shall follow up and ensure that we implement them. At this juncture, I think I'm going to, if there is no any other thing that has come up, I think I'm going to officially close the workshop. So I declare the workshop officially closed. Thank you, thank you. I wish you a safe flight back, a safe ride back, and a safe drive back to your respective destinations. Thank you so much for coming. We shall meet again next time. Thank you.
Thank you. Those who are online, you can turn on your cameras, those who can, so that we take that screenshot.
We don't have copies of our.
Yes, we are going to collect all the evaluation forms and commitment forms. We shall send you copies of your commitment forms. But for now, we are going to collect both. So those who are online, cameras on. I'm taking the screenshot now. You can smile, say cheese.
Thank you very much.
Yes. All right. Thank you very much. Jocelyn is collecting the forms. Jocelyn, you can wave and let the people see you. She's collecting the forms. Those are online. We can now log off. Thank you very much. We shall be in touch with you to share with you the forms as well to your emails.